to honourable members. Good morning to the Minister, HOD, and senior management of the Social Development Department. Allow me also to welcome all guests present this morning. It is Thursday, the 10th of October, and we will be dealing with the annual report on social development for the 2023-2024 financial year. We are also set to have some special guests from KwaZulu-Natal. I do not see them yet, but we will welcome them once they join the committee this morning. At this stage, I'm going to ask members and then the department to kindly introduce themselves for the record. My name is Wendy Kaiser-Philander, and I'm the chairperson for the Standing Committee on Social Development. Good morning.
Good morning, Chairperson, and good morning to the Minister and the professionals. I'm Emery Boyson, and I'm a member of the Standing Committee. Thank you.
Good morning, Honourable Chair. I am Leon van Wyk, a member of the Standing Committee on Social Development. Good morning to the Minister, the HOD, and the officials with us today, and as well as the other honourable members with us. Thank you.
Good morning, Chair, Minister, all the guests, colleagues. My name is Francois. I'm part of the Social Development Committee. My naam is Francois. Ek is deel van die Social Development Committee. Dankie.
Good morning, Chair, Minister, HOD, and officials. I'm Donita Stevens, and I'm a member of this committee.
Hi, dankie lede. En dan...
Sorry.
Oh, my apologies, member.
Morning, everyone. I'm Benedicta van Minnen. I'm a member of this committee. Thank you, Chair.
Thank you very much. Member van Minnen. Member Kamfer.
My colleague, member Van Vogel, she is on his way. Thank you.
Thank you very much, Member Kamfer. Duly noted. Member Van Vogel will join us a bit later. Online, we have Member Kasim.
Good morning. Thank you, Chair, and greetings to all. Member Aisha Kasim, also a member of this Social Development Committee. Thank you.
Thank you very much for joining us, Member Kasim. And then I give over to the Minister and the HOD for introductions of the department.
Goeiemôre, agbare voorsitter, and good morning to all the members and all the guests that's online or will be here. I think everybody can introduce themselves, but I am Jaco Lont, and I'm the Minister for Social Development.
Good morning, Chair and honourable members, and to the officials. I'm Robert MacDonald, the Head of Social Development.
Good morning, Chairperson and honourable members, Minister, HOD, and all the colleagues. I'm Juan Smith. I'm the CFO for the department.
Good morning, Chair, members, colleagues. I'm Din Bali, the Director for Finance in the Department of DSD.
Good morning, Honourable Chair and members. I'm Charles Jordan. I'm the Chief Director for Children, Families and Vulnerable Groups. Thank you.
Good morning, Chair. Good morning, honourable members. My name is Thembekile Kwakweni, Director of Children and Families within the Department of Social Development.
Good morning, Chair, members. Leona Goosen, Chief Director, Social Welfare and Restorative Services.
Morning, Chairperson and honourable members. My name is Van Reenen, Chief Director, Service Delivery Management and Coordination.
Good morning, Chair. Good morning, honourable members. I'm Mashinette Jonkerman, Director, Facility Management. Thank you.
Good morning, Chair. Good morning, honourable members and colleagues. My name is Abdurraouf Raycliffe. I'm Director, Restorative Services. Thank you.
Good morning, Chair, honourable members. Siam Liftaghdien, Director, Business Planning and Monitoring, and also Acting Chief Director, Business Planning and Strategy.
Good morning, Chair, honourable members. I'm Petronel van Wyk. I'm currently the Acting Director, Operational Management Support.
Good morning, Chair. Good morning, members. Tasneem Rakib, Director, Supply Chain.
Good morning, Chair, honourable members, my colleagues. Patiswa Momoza, Director, Vulnerable Groups. Thank you.
Thank you very much. And then we have missed some colleagues there at the back.
Morning, Chair. Morning, members. Karen Scholes from the Department of the Premier, People Management Practices.
Good morning, Chair, members and colleagues. I'm Esther Lewis, Head of Communications for the Department of Social Development.
Good morning, Chair. Good morning, honourable members and colleagues. I'm Monique Mortlach-Malgas, Media Liaison Officer for Minister Lont.
Thank you very much. Minister and HOD, no officials online? All in chambers? Sure. Thank you very much. Colleagues, at this point, I am going to allow the Minister to give some brief overview remarks in terms of the annual report under review. Colleagues, as you know, I've mentioned, the purpose of today's meeting is to deliberate on the annual report of the Department of Social Development for the 2023-2024 financial year. And this annual report monitors the Department of Social Development's performance for the 2023-2024 financial year against the predetermined annual targets as was outlined in the 2023-24 annual performance plan. So, Minister, I'm going to give over to you, and then if the HOD wants to add on, you are most welcome to do so. Thank you.
Thank you, Chairperson. And colleagues, you know how the world of politics works. If this was a report that was not really good, I would have been on the red carpet and I had to take all the answers from all of you. But I must say I'm incredibly proud of the team that's sitting here next to me and behind me. We work in a fiscally constrained environment nationally, but also in the province and especially in a department where you have to look after the most vulnerable. And with the little that this team do get, they make sure that the rand gets stretched a lot further. And I think it's now the 13th clean audit in a row. So from my side to the team and what they do and how much they achieve with the little bit that's entrusted to them, I thank them. And my hope going forward is that the province and the department get the necessary funding to ensure that the work they are doing now can be expanded and we can ensure that that safety net we need to provide to the most vulnerable gets strengthened. So, Chair, that's all from my side for now. We can get into it. I know some of these sessions can get quite long. Thank you so much.
Very much, Minister. HOD.
Thank you very much, Chairperson. I think in the spirit of the Minister's last comment, I also won't add too much other than just to thank the team for the work done in the year under review and also to thank the Minister for his support in coming into the new term. This has been a very tough year that is under review, and I think a lot of that is set out in the document. We found ourselves very much in a disaster response mode, not only due to the ongoing economic after effects of COVID, but also with a number of other things, including that big power outage in the central Karoo, for example, which required urgent response and a number of floods and other incidents. So it's really stretched the department, and I think that the work done during that period was outstanding. But also, I think to add that things are under strain significantly, and some of that will be evident in the report. Some of it will become increasingly evident over the years, this year and next year, if the situation continues to be as constrained as it is in terms of resources. So we are concerned. We've been flagging that consistently, I think, in this committee, that the resource constraints are becoming a risk for the beneficiaries of the department. And I think it would be our duty to flag that things are not running as smoothly as we want them to be running, but we are trying to maintain the most essential things as best we can to avoid our beneficiaries unduly suffering. So yeah, I think that is the key thing that's top of mind for the department when we go into this reporting period. Thank you.
Thank you very much, HOD. Members, at this point, I'm going to ask if you have any questions based on the brief overview provided by the Minister and the HOD. I do not see any hands in chambers. I do not see any hands online as well. Colleagues, please note that we do have a time set for the session, but I'm not going to take away anything of us efficiently and effectively interrogating what is in front of us today. So I, from the onset, just want to ask members, please, that we, once we get into the flesh of it, please direct your questions directly to a specific page on the specific section. But perhaps we just need to determine as well. It would perhaps not be advisable to go page by page, because I trust members had the opportunity to go through the documentation and formalize their questions or their comments accordingly. Is it in order with members if we deal with this report section by section? You then pose your questions on the relevant pages and the Minister and Department can then respond accordingly. Can we reach concurrence on that, members?
We support, Chairperson. Thank you.
Thank you so much. Honourable members, and then I direct you to Part A of the annual report, which is the general information from pages 9 to 34. If members have any questions on those specific pages, you are welcome to indicate so by a show of hands, please. Part A of the annual report. I don't see any hands on Part A. Member Stevens, I know you are in a bit of a fix by not receiving the book. Did you receive the research analysis by WCPP, perhaps? I know it was sent to us via email. That could perhaps have given you some direction. Printout for. Can I have a printout?
Chairperson, we have an extra book that we can share and give to the member.
Thank you. That will be much appreciated. Member Stevens, we are then now on Part A, which deals with the general information, pages 9 to 34. Any questions, members? Good morning, Member Van Vogel, and thank you for joining us this morning. If you can kindly introduce yourself, please.
Morning, Chair and everyone. My name is Rachel Van Vogel and I'm an alternative member of this committee.
Thank you very much, Member Van Vogel. Member, we have just about started and the meeting resolved that we will be engaging the annual report section by section. So we are now on pages 9 to 34. Any questions from your side on Part A of the annual report? You are welcome to indicate so now. Member Stevens? Are you satisfied? Thank you. Anything from your side, Member Comfort? Nothing at this stage. Member Van Wyk? Not. Member Boyson?
Nothing at this stage, Chairperson.
Not at this stage. Thank you. Member Van Minnen? Not now. Member Windvogel? Part A, correct. Pages 9 to 34. Nothing at this stage. Colleagues, then part A is then, I believe, dealt with. We then move over to part B of the annual report, which deals with the performance information, pages 35 to 90. Whilst members are gathering their thoughts, I see we have guests at the back. If you can kindly introduce yourself for the record, please.
Morning, Chairperson, members. Warren Wilson, Department of the Premier, People Management.
Morning, everyone. Liesel Baran, People Management.p.
Thank you very much, and a warm welcome to you as well. Members, I see Member Van Wyk.
Thank you, Chair. I think if we look at Part B and the predetermined objectives, firstly, I want to state, it's quite clear that the department has done very well to virtually spend all of its allocation of funding. However, if one looks at pages 35 through 37, 30, 38, and one looks at the work that's been undertaken, that it's very clear that the funding that's available is almost just scratches the surface in the plight that we have out among the various vulnerable people that this department is trying to deal with. And, maybe if they could perhaps just provide some form of comment on how they are dealing with this and what else possibly needs to be done to try and improve that situation, given the huge constraints on funding that we have. It's also quite clear, we'll see at certain parts in the report on how they needed to step up in the Central Karoo at the time of that electricity failure. And, fortunately they still had funding available. But I must say it is of considerable concern that we have so many citizens who are in effect in deep distress out there. And the question to me is, how do we actually get more funding and more assistance to people there? So I'm not sure if they are able to provide some comment there or some thoughts.
Thank you very much, Member Van Wyk. Member Boyson? Covered. Member Van Minnen? Covered. Member Windvogel?
Thank you so much, Chair. Chair, mine is on page 37, paragraph 2, in terms of sexual offences. What I want to understand from the department, what was their response to this challenge? Are the resources allocated enough to meet this demand? Then also on page 37, the last paragraph, violence against women and children. I want to check what progress has been made in implementing the Western Cape Drug Master Plan, additionally for those local drug action committees that have not been established in many municipalities. What are the updates? Can you give us some updates on that? Then, Chair, on page 44, when we look at the organizational environment, the vacancy when it comes to employment and vacancies. The employment, I'm just worried, and I think the employment of social work graduates is a step in the right direction. But do you have a understanding of, do you know exactly how many graduates do we still have who are unemployed? And do you perhaps have a plan of when it comes to them? Then on staff safety, also not also on page 45, I just wanted to check, why are we not, of the department, not engaging the local community, communities, including the CPF, we have the neighborhood wards, and those different safety groups in our community. Why are we not also using them when it comes to, except the police, when it comes to the safety of your staff? Then I want to understand the intervention that are being implemented up until now. Because if you look at I think one of our meetings, that was one of the issues that comes out, the safety of our staff, of your staff members. Then lastly, Chair, on page 55, sub-program 2.2, residential care services facilities are available for our older persons. Could the department provide a detailed explanation for not achieving the target, and why was the approved budget less than less than it was anticipated? Thank you so much, Chair.
Baie dankie, lid Winvogel, en dan lid Kasim aanlyn.
Thank you very much, Chairperson. I've got two questions. The first one relates to page 53, and I think the page thereafter with regards to services to older persons. I just wanted to check with the department when it comes to funding different old age homes across the province. Is there a specific criteria before you do that funding? Because if funding is supposed to benefit those in need, especially in underprivileged communities, and we've done oversight, and one of the old age homes that is funded by the department specifically said that they don't take elderly people who only have a grant. So they would prefer, meaning that they would reject those people and put them on a waiting list and then prioritize those who have an additional income from family. So I just wanted to check the department's stance on that, because I've noticed that, if I'm not mistaken, Chair, it was at Badisa, because and they said that was their policy to reject those who don't have an additional income other than a grant. Is it only that specific Badisa? Because in the other regions, some of the Badisas are taking elderly people who only have a grant, a SASSA grant. So I just wanted clarity on that one. And then also, in terms of social workers in this section, what support or backup is there for social workers in the province who have been working for more than a decade? Because I've noticed that a lot of them are working within hospitals and specific centers with the staff card has the Western Cape government's logo on, but they don't have access to pension or any benefits after they leave with this, because I know some of them have been working for 10 and 20 years and they don't have access to benefits like that. So if I can just get clarity from the department in terms of that. Thank you.
Baie dankie, lid Kasim, en dan lid Kamfer.
Thank you, Chair. My is simple, Chair, is page 35, is under service delivery, part B, is paragraph 2 under service delivery. So what I know, or what I will understand, what is the impact of service security for children's in Afrikaans is dit, wat is die impak van die onsekerheid rondom kinders as ons kyk na die huidige situasie rondom die paragraaf 2 op bladsy 35. Dankie, Chair.
Baie dankie, lid Kamfer, member van Minden.
Sorry, I do indeed have a question. one thing is that it's all, now this is page 55, where we talk about residential care facilities for older persons, the approved budget for residential care facilities. I want to stay on topic, but once there are approved residential facilities and there is a situation where there is a dispute, I just want to find out how the department goes about dealing with disputes of oversight bodies, including ensuring that the quality remains as it is supposed to be, so there isn't a drop off in care. That's the one aspect. And then, Chair, I just want to clarify, we do need to be correct. If I remember correctly, the care facility that was under discussion by my colleague earlier has a target of 10 beds for which they use people on SASSA grants. So in fact, accommodate 14. And if I remember correctly on the briefing, it was a case of them saying they couldn't accept more people over the 14, which is already in excess of the 10 subsidized beds, because they can't subsidize further than that. So I just want us to correct that for the record. We mustn't have inaccuracies in the record. Thank you.
Thank you very much, Member van Minnen, and I concur with you on that. Just before I give over to the department, I don't see any further hands at this point. Members will have an opportunity to ask some follow-up questions.
Chairperson.
Member, can I please ask that you make use of the raise hand function? You may
My
proceed.
hand has been up. Thank you. Just in terms of before the department gives a response to that, if I remember correctly, I asked this question to that specific old age home, and which the previous member also commented on now. And she confirmed that the policy, she said it in this way, the policy is to reject those who only have a SASSA grant and to accept those who have more than just a SASSA grant. So that's why I'm asking the department to give a response with regards to that comment that was made by the old age home.
Thank you very much, Member. We're not going to go into debate amongst members. We're going to allow the Minister and the department to respond accordingly. Perhaps just from my side, Minister and colleagues of the department, I must say, and I must commend the department that the bursaries, I think one of the members spoke about social workers, and indeed the report reflects that 86 bursaries were awarded, even more than the department anticipated, and also more social workers were indeed employed as well. I'm not going to go into the safety issue at this point in time, but I also at this point want to commend the department for the interventions in that regard, as well, as we do know the very importance of our social workers in the field as well. Minister and colleagues, just in terms of the youth on page 36 makes reference to the number of youth in the province, as well as the risk areas and so forth. Youth that is not in employment, education, and or training are identified by the department as a priority. And it also states on page 36 that the department aims to provide them with access to online, digital, and after-school academic support through collaborations with youth cafes and community-based organizations. Now, during our joint oversight visit last week, what we have seen at two different instances, I think the one was at the KwaNokutula CDC, and the other one was at the Thembeletu CDC, where there are innovative approaches to keep the youth busy. But we did not hear that there is a direct link with social development in that regard. So it seemed to the committee at that stage that is programs run by the different facilities to keep the youth at risk busy in the afternoons with various programs, skills development, and so forth. But my question would be, is that something that the department intend of tapping into at some point in time? Because at this point, it seems as if it stands loose, but if there could be a collaborative approach, it could be something more sustainable. So that would be my question at this point. And then, Minister, I give over to you, and you and the HOD can just direct us as to which official will respond. Thank you.
Thank you. So I am going to start with Member van Wyk. We obviously this is now looking into the rear view mirror, the year that is behind us, or the financial year at least that's behind us. And he correctly pointed out and that echoed what myself and the HOD and others have said, that it's not sustainable the way things are going now. And you've asked what we are doing to try and turn around the situation. Now that at several levels, there's engagements. There's at national level, we have our representatives there that is they're having the conversations to make sure that as a province, we're now the third most populous province, but we're getting the fifth highest share of the funding. So we need to get that share of the funding. And then when that happens, also within the province, we'll put forward our arguments as to why we should get a bigger share of the budget. Yourself having been in situations where you have to move budgets around, you know that's a balancing act, but we will make sure that we put forward the best possible argument for this department and the clients that we serve. But then also, Chair, through you, we have gone beyond that. We have already engaged with international organizations that have a footprint internationally, the private sector, other successful organizations that do partner with government to see how we can supplement what we do get through government and make sure that we then better support our partners that take our hands and make sure that we stretch that rand so much further. And then, Member Winvogel, you were correct. It is our staff members. It's not just the department staff members. And we all look after them. And the HOD or Chief Director Van Renen will speak to maybe the cost of what it is now in terms of time of getting the buddy system in place to look after our staff, because now you need to double up human resources to make sure that they are safer. But that then is also counterbalanced with bringing in technology, and the standing invitation is still there to the committee to introduce you to the SWIMS app to actually see how much time is being saved. So on the one hand, the department has done incredibly well embracing technology, making sure we free up many more hours that can be reinvested into looking after our clients. But then unfortunately with the hotspot areas, that time that we've been saved then kind of gets negated again with the buddy system. But then, Chairperson, I will allow then the HOD to go through some of the other questions and then refer it to some of the chief directors or other staff to answer. Thank you.
Thank you very much, Chairperson. In terms of Honourable Winvogel's question around page 37, paragraph 2, what is the department's response to the sexual offences in the province, and are the resources that are currently allocated enough? I think the first thing is the resources are not yet enough. There has been significant increase since 2019 in the resources. If you look at the budgets, particularly for victim empowerment services in the Department of Social Development, but also in the other departments where we've got a lot of developments around, for example, the introduction of court watching briefs for GBV cases in the court system, as well as expansion of the Tutuzela care centres in partnership with the Department of Health and the prosecuting authority. But overall, for this period, we have what is called the implementation plan for the National Gender-Based Violence NSP. So National Cabinet introduced a national strategic plan to combat gender-based violence during the last term. I think it was in 2020. And we then began to implement or to develop an implementation plan for the province that gives effect to that plan. That plan does call on all provinces and all bodies, government bodies like the SAPs, to have their own implementation plan. So we did develop and adopt that, and we are in the process of implementing that plan at the moment. I think we have previously presented to this standing committee on that implementation plan, and we certainly can do so again. I think the implementation plan is looking across all departments in the province. So it sets out what needs to be done under each of the pillars of the national strategic plan for gender-based violence. So the Department of Social Development has specific roles in respect of that, other than actually also coordinating the gender-based violence plan for the province. We are also implementing specific projects mainly under our Victim Empowerment Program Office that funds shelters for women who are victims of GBV. It also funds therapeutic services at the Tutuzela care centers for victims of sexual violence. And we have also appointed GBV social workers in our regions, in our local offices, as well as the launch of the Gender-Based Violence Ambassador Program, which involves mobilizing communities against GBV. I think in addition to that, we should also mention that we've used the properties made available to this department by the National Department of Public Works to establish shelters there as well. So there's a lot of work ongoing in that space, and some of those indicators are in the annual report, particularly if you look at the indicators on the number of victims of violence and abuse that have received support from the department, as well as the number of GBV victims who've been accommodated in shelters. So you'll find those indicators under the program of victim empowerment services. So yeah, there's a number of things happening in that space. I don't know whether our Chief Director, Ms. Liana Goosen, would like to add anything further on that. Her Chief Directorate leads the coordination.
Thank you, HOD. Ms. Goosen?
Yes, thank you. To stretch our hand better, we have implemented a geo-mapping system where we map where's the prevalence of GBV in the province, so that we don't try to hit all with little money, but focus specifically on the high-risk areas. And it slightly differs from the crime stats in this province. And that also assisted the VPU unit at Department of Health to also know where to target their specific areas in terms of their interventions. So that was really a groundbreaking exercise, and you will see in our NFD data that there's been a substantial increase in the clients that receive psychosocial support, actually above what we envisage we will do. We think, and we are quite sure that that is as a result of the work that's being done over the past 3 to 4 years in terms of the strategy. And because we don't only attack GBV from a Department of Social Development perspective, but across all provincial departments, and of course then through partnership with our stakeholders. Thank you.
Thank you very much, Ms. Goosen. HOD?
Thank you for that. The second question from Honourable Member Van Vogel is about the progress on implementing the Western Cape Drug Master Plan. The Western Cape Drug Master Plan, which is established within the National Drug Master Plan, is in full implementation. We have a dedicated person appointed to coordinate the Western Cape Substance Abuse Forum, which is established. We have also assisted municipalities with setting up local drug action committees, and most of the municipalities are now running with local drug action committees. I can give you a list, Chairperson, but it's a bit long to read here. So, but I can perhaps provide that in writing if that's required. But yeah, the local drug action committees are active in the majority of municipalities. We do also have lots of innovative ideas coming out of the municipal space to support the work that the province is also doing. The majority of the mandate to address substance abuse in the province does sit with the Department of Social Development provincially. And we do have a program office for substance use treatment and prevention programs. And the budget and the targets are set out in the annual report in some detail. But the program office is providing prevention as well as community-based treatment programs and residential treatment programs and aftercare services in line with the treatment model that sits in the master plan. The local drug action committees, their function is to coordinate between the department's services and local stakeholders like the South African Police Services, as well as health and municipal officials. And they are appointed by the mayors of the municipalities to do that function in terms of the Prevention of and Treatment for Substance Abuse Act. So the Department's Substance Abuse Forum also continues to report annually to the Central Drug Authority on the activities of the forum and the progress in implementing the Provincial Drug Master Plan. And we can make those reports available to the standing committees should they require that. I think also to say that the substance abuse program in the province during the period under review has been quite constrained financially as well. It was one of the programs we haven't really been able to increase funds to due to the financial constraints, because we've had to prioritize funding towards some of our other statutory responsibilities like child protection. I think in terms of the response around substance abuse, it must be emphasized that social development doesn't work alone. The police also have their own plans around demand reduction and tackling organized crime and drug trafficking. So we also get regular reports from the SAPS on that in our substance abuse forum. In addition to that, the other departments in the province also have an involvement in this, particularly health that does detoxification for people with opiate or alcohol addiction, as well as providing treatment for people with dual diagnosis, substance use disorders and mental health disorders. So there is a lot happening in that space. I think, though, that one has to emphasize that the biggest harms around substance use in the province remain alcohol associated with alcohol misuse. And there is a particular association between alcohol misuse and the high rates of murder and trauma in the province, as well as accidents involving pedestrians and passengers and drivers of vehicles. So alcohol remains a very high priority in terms of harm reduction for substance use, and there's ongoing work around the liquor legislation at the moment to address this. In terms of the question from Honourable Member Windvogel about vacancies and the number of graduates that are still unemployed in the province, we do have a list of the people who still have not been placed in the department. I'm not sure if that list is immediately available, but Ms. Van Wyk, do you have the numbers?
Can I please ask to switch on the mic?
Excuse me, yes, the list is available. I'm not 100% sure of the numbers, but it's around about 100 around about 100.
We can provide the exact figure to the committee, but the numbers come down a lot. I think the other thing is that we find when we do sometimes approach those who've had bursaries some time ago, they've already found employment when we do approach them. So a lot of them have found employment in the NGO sector and in other opportunities. The National Department of Social Development has been engaging with other departments that work with social workers to try and see how nationally they can tackle this issue of social work graduates who are unemployed, to look at other sectors like health, education, as well as the private sector, to see to what extent they could help also with taking up those unemployed graduates. So it is a national process. We are part of that process as well. But I think in the province, we don't have very high numbers of people still waiting. But the concern we have still is, of course, the ability for us to sustain the use of graduates in our staff, in our own department because of the budget constraints around compensation. We see that there's a huge benefit we have to bringing in these graduates as additional capacity to the department. So we're hoping we'll be able to continue with that as far as possible. But it is something that is under strain as well. In terms of the question from Honourable Member Windvogel about staff safety, and we did brief the committee about some of the measures that we were putting in place previously. And I think just to recap, we've been arranging with the government garage office in the Department of Mobility to assist us with unmarking of some vehicles in high-risk areas, as well as changing the number plates from government to non-government number plates in an effort to make the vehicles less conspicuous in the high-risk areas. We have also been asking for assistance with updating the tracking system to try and make it more difficult to foil. I won't go into details on that, but the other aspect as well is that we've been working directly with the SAPs to try and get some assistance from them. We've given them all the case numbers of the hijackings and provided directly to General Patekile. The incidents have also been reported at the local SAP stations, of course. We've also asked the SAPs to assist with escorting, but as the Honourable Member has mentioned, the CPFs and neighbourhood watches can also assist, and we have been tapping into that through the area-based teams that the social workers are part of. So they have been asking for assistance, and they have been building relationships with the local community structures to try and get some additional support. The other interventions that have been implemented have also been the buddy system, where we've asked the social workers not to go out alone, and then SAPS has been asked to accompany our social workers into the higher risk areas, and staff have been told not to go into high risk areas until they have SAPS accompanying them. So the province has a problem with this across the board. It's not only in social development, and the DG has also been engaging the unions about this issue and giving them feedback to keep them in the loop, and also try to look at how we can take hands and create joint solutions. We also found that this problem is affecting other spheres of government too. So it is a very difficult one. Some of these hijackings also occurring when staff go home with the government garage vehicles after they've worked, particularly after hours. So we've encouraged staff to rather leave their vehicle back at the office and either bring their own vehicle in or utilize other means of transport to get back to their home, because it seems that they are becoming targets when they take their cars home, particularly those staff who are living in high-risk areas. Because that is a pattern that is dominating most of these incidents. In terms of the question from Honourable Member Windvogel on the explanation on not meeting the target around older persons and the budget adjustment there, I'll ask Mr. Jordan to provide some more details. Thanks.
Thank you, Dr. McDonald. Mr. Jordan.
Thank you, Chair, and member that asked the question. Yes, if we look at the report, the target, for example, was set at 4,906 to subsidize. Now, these targets are usually set in February. The final date for submittance of APPs is February month. So that was based on budgets we had in the previous year that you set those targets. Then with this financial year, the budget was cut drastically, and we only got that information basically in March month after the APP has said. So that's why the one reason that was said there was the approved budget for residential care facilities was less than anticipated. So we anticipated we were going to get money for 4,906 people, but at the end of the day, we got money less, that we could not fund those people. So that's the reason. Why did we also get less budgets? I think it's all part of that whole situation where salary increases of staff had to be given. All the money was not provided by National Treasury and Provincial Treasury, and the department had to reprioritize as well its own budgets in able to pay the salaries of staff, the increases. So that is the main reason. Then I must also add in this synopsis is also one old age home that closed down in December 2023. Currently in this financial year, although it's not related to this report, you will also see we're not reaching the targets because there's another two old facilities that closed down now that by the end of March, beginning of April of this financial year. Specifically Jagerbosch assisted living and independent living facilities in the Witstrand area. So they've declined their budget, saying, sorry, they can't run these places anymore because of financial cash flows. So that will also have an effect on your targets that you've set when somebody decides to close down, because that's targets you've budgeted for or looked at least. Yeah, thank you.
Thank you, Honourable Chairperson. Then also maybe Mr. Jordan, you can speak to the question about the from Honourable Member Kasim about the criteria of funding old age homes and the issue of the old age homes not accepting those who are on SASSA grants.
The one-off funding criteria, the first thing before we fund any old age home, and I must also add now, the old age homes that we're currently funding, the 114, historically, we've been funding for the past 10 to 20 years. If my memory serves me correct, we have not recently started funding any new old age homes just because of the fact that there is no money. So what is the process with funding or the criteria? The first thing would be with the current ones that we fund every year, we would do a desktop assessment as well on their audit financial statements. They need to comply with progress reports. They need to be registered or still conditionally registered, which adheres to municipal bylaws. So it's not only these criteria, but it's also municipal bylaws of the local municipality that would make them, if they would be compliant or not with certain things. So that would be the reasons why we would fund them after we've gone through that full desktop assessment. The issue of SASSA, the honourable member is quite correct that asked this question. This is now a total fallout of budgets being reduced, less money going to older persons and residential facilities. We all know that cost of living has gone dramatically up, but we haven't increased funding for them for 80 years, or 8 years ago was the last time it was increased. So that effect would have, they don't have proper cash flows in the old age homes anymore. They can't do proper maintenance. It's starting to have an effect on service delivery. Some of the old age homes are very innovative, that they actually can just sort of survive. Some of them are not surviving at all. And I've got a list of them. I know exactly who they are. One of the criteria that the boards have decided, and this is not for DSD to decide because this is NGOs, that's independent. They've been registered according to the NPO Act. DSD do not have the mandate to tell them who to take in and how to take in people. So you would find that some of the BEDISA ones do not have a problem to take in people with SASSA grants. The SASSA grants, we all know that's about 2,000 something. 90% of that money goes to the old age home. Then also it's the subsidy from our side. But there is some old age homes that have made that decision. Their boards have decided, sorry, we cannot take in SASSA recipients anymore because my unit cost is 10,000 Rand a month to take care of an older person. I get about 3,000 Rand from DSD. I get about 2,000 Rand from the SASSA grant recipient SASSA money. That's 5,000 Rand. Where must I get the other 5,000 Rand? So immediately by taking in a SASSA recipient, they're already in deficit of 5,000 Rand per month, per person. So there's two scenarios that some of the old age homes have been doing that I've been picking up. And the one is they do not take in SASSA recipients because that is not a financial burden on the old age home anymore. Or it sort of reduces that whole issue of financial burden. The other thing would be that some of them then start taking in people that's not SASSA recipients, that's got private pension funds, that gets an income like 10, 15,000 Rand a month from their current private pension fund. And then they charge them 10,000 Rand and use some of that money to cross-subsidize the remaining SASSA recipients. this is the whole circle that I've mentioned to the standing committee in a previous meeting. The fact that budgets are not increased, we are placing these old age homes at risk financially. So yeah, that is that in a nutshell. Thanks.
Thank you, Mr. Jordan. I think also just to maybe add, Honourable Chair, that we subsidise per person at the old age homes, and we only subsidise those persons who are SASSA grant recipients. We don't subsidise the private the people who the old age homes take in who are paying a higher rate. So if an old age home has a policy that says no, we are not taking in any more people who are on SASSA grants, we then wouldn't fund that old age home. We only fund per person who is on a SASSA grant. So some of the old age homes, like Mr. Jordan has said, they may have 50 people there, and 10 of those people are on SASSA grants, and the rest are paying a full amount for the cost. Then the department would only subsidise those 10 people who are on SASSA grants. We don't subsidise the other people who are paying in full, because otherwise, then that would defeat the purpose. So just to be clear, our policy is only to fund beds for SASSA grant recipients in old age homes. We don't fund the people who pay the full amount, if that's clear. I think so. So in the case of the Bediso home that Honourable Kasim had mentioned, if they'd reached their limit of SASSA grant recipients that the department is funding them for, they wouldn't be able to afford to take on more people unless they could find another way of cross-subsidizing those SASSA grant recipients. And we can't expect them to take in more people than we fund them for as well. So I think that's how the system works from our side. In terms of the question from Honourable Member Kasim about what support there is for social workers in the province who've been working more than a decade, I'm assuming this is in reference to social workers who are in the NGO sector, because social workers who are working in the provincial government would obviously have all of the benefits of the employee pensions system that is there for the public service, the government employee pension fund, etc. So if I take it that the question is in relation to the NGOs. Some of the NGOs do have a system of pension and all of those necessary things in place for their staff members. Where the NGOs are not implementing those measures, it would really depend on whether they're using a total cost of employment package system for those staff members. But there's also a question of whether that meets the basic conditions of employment regulations and legislation. So where if staff members are in a situation where they are not being treated according to labour legislation, they then of course can take that up with the Department of Labour. We as a Department of Social Development we don't get involved in labour matters between NGOs and their employees, because the Department of Social Development is funding those organisations for furtherance of their operations. We are not the de facto employer of the staff members, and we don't have any legal standing to intervene in any way between an employer and an employee in an organisation that is separate from government. It's the same principle that applies, for example, if you hire or tender for a service provider, that service provider is still the employer of their staff, even if we contract with them. We don't become the de facto employer. The labour law is quite clear on that. But certainly, if staff in any way will be treated unfairly, there is the recourse to the Department of Labour or to any of the dispute mechanisms that are provided for in South Africa for workers to seek for their rights to be protected. The department does fund organisations to hire social workers. But again, it's funding for their operations, and we fund an amount. They are at liberty to to pay their social workers more than what we fund them with the additional donor funds that they raise. So the Department of Social Development, because of the way the transfer system works in government, we partially fund or subsidize. We don't fully fund organizations. If you look at the legislation around transfer funding, the principle is that transfer funding must be a contribution towards operations. It can't be a full funding of an organization in the way that it might be if you go through a tender process. So it's a different principle. So we do fund subsidies towards posts, but it's certainly not the limit of what NGOs can pay their staff or what benefits they give them in addition to that. But I also should mention that we do expect the NGOs to at least pay the minimum of what we do give them. In other words, they can't divert money that is provided to the department for posts and pay their staff less than what they are being given for that, because for then we look at it in terms of misuse or rather not using the funds for intended purposes. So we do police that from that point of view. In terms of the question from Honourable Member Comfort, I wasn't sure I fully understood. I think the question was about the impact of the children at risk in general, if I understood it correctly. And I think that's a very long answer I can give you on that because there's a huge impact of that, obviously. But for us, I think our biggest concern at the moment is that we've got a very high rate of children at risk. The number of children going into foster care is going up. And it's placing a huge strain on the government system. We're struggling to find enough safety parents and foster parents to support these children. We are struggling to accommodate children in our child and youth care centres because the centres are full. Particularly our secure care centres for children with behavioural problems. They are very full and under strain. It's an extremely expensive service to render as well, so it puts a huge strain on our budgets. I think in addition to that, I mean, the concern as well is that a number of children are dropping out of school, the absenteeism and so on, and that has a knock-on effect because these young children grow up to be adolescents and youth without qualifications, and they add to the number of young people who are unemployed, which of course is a big contributor to the high rate of crime. The bulk of crime that is being committed is by youth in the province and in the country. So the impact is enormous, and that's why we take our role in child protection very seriously as a department. And that is why that is one of the areas that we have to protect at all costs in terms of our budget allocations. And that is one of the huge difficulties we're sitting with now, where we're having to make trade-offs to keep child protection going at the expense of other programs like the older persons programs and disabled persons programs, which is a terrible thing to have to do. But I mean, equally, we are also asking Treasury to make trade-offs between social development and teachers, or social development and doctors and nurses and so on. So these are very hard questions for us to negotiate. The question from Honourable Member Van Minnen in terms of how we deal with disputes with boards in old age homes and how we deal with this without allowing services to become compromised to the older persons. I'll ask Mr. Jordan to come in again on this. Thank you.
Thank you, Dr. McDonald. Mr. Jordan.
Yeah, member. I'm starting to laugh because it's such a complex situation with these boards that fight with each other that I sometimes feel I want to run into the bushes and never come out of it again. I think the one fortunate thing for me is if I look at 114 old age homes, we've got 3 old age homes that's got these issues, of which one is that you see exactly happening in Vermont, the one that you did the site visit. First and foremost, it's very difficult to manage political conflict between people. There is also self-gain from certain individuals. The question is, who can you trust in that group of those 2 conflicting boards? Because when we start engaging them, we have to look at who's telling us the truth, who's not. We need to gather information. We need to gather evidence. We talk to them. Then we sit in meetings with them and then they start attacking each other. A lot of times we had to call in the police. There's situations where sometimes the board that lost out, and that's the old board, they would come and try and take over the place, causing disruption. They would still have staff inside the old age home that was affiliated with them that they would sweep up. You would find them even getting a group of residents in the old age home being swept up to talk against the current board. So you've got to deal with all those complexities on a regular basis. Then you would find some of them would go to the newspapers, tell stories about this and that. Yes. Then every time we have to investigate that. Yes, sometimes it's lies. Yes, sometimes it's the truth. But every time we need to do that. In these negotiations, what we need to do as a department, we need to make sure who do we recognize at the end of the day as the legal board. So in this one specific case, dealing with conflict, we approach legal services with documents and stuff. We actually asked them, please give us legal advice so that we can see who we should identify as the legal board, even if it's an interim board. So those kinds of stuff are being done also with legal services so that we legally, if we have to go and stand in court, we actually have evidence that we have also legally consulted and our lawyers also have given us indication who should be the legal one. The question of recognizing a legal status, it's very important because that's got to do with the bank accounts of the old age home. Now you will find the one board that's not being recognized as a legal one, go open other bank accounts, or they would sabotage the current bank accounts. Then we need to deal with the bank to prove to the bank who we as DSD recognize as the legal one. So it's quite involved. I think sometimes we are successful, sometimes we're not. I'm going to be very honest about it. It's very, very difficult. The thing that concerns me the most out of all of this, just look very closely. Who's the ones that's all self about themselves and not really concerned about the old people even inside? That's usually how I look at the situation, where I sometimes, besides the legal aspects of where we've got confirmation who we should recognize as the legal board, it's a very soft thing. You need to be very careful when you talk to individuals to see, is it all about myself? Is it all about money? Is it also, do you actually talk about the old people? Sometimes some of them don't care really about the old people. It's all for self-gain. The other big thing that's for me also a concern, then they start sabotaging each other as well. And I think you've seen that as well. Where actually things are being done to make the other one look bad. I don't say the other one is 100%, but they start playing games. And it's playing games to get into a power position to say who's not actually in charge here. So that's how we deal with the conflict. I can say that since this department has always been developmental in approach, part of our mandate is also to try and see how we can assist. So a lot of times our boards are also being capacitated. So we've got a unit, we've got our M&E people that capacitate those boards. We've got even our own staff, our policy developers, that would go and sit with them and tell them how you should do things and what else. In these specific old age homes, there's even a service delivery improvement plan of what they must achieve and correct. But the stance of this department right now is no more. I'm not going to allow these things because I'm very concerned about the health and safety of the old people. We've come to a point where developmental approach and helping and trying to solve problems is not benefiting us at all, or even the older persons. It's not bearing any positiveness or success. And for that, then the department needs to look at a more appropriate process, taking more stricter lines, putting the lines down and putting the boundaries down, and then start with processes to see what's the next step that we must legally follow. So when this goes to court, we actually have enough evidence in court, because these things will go to court. Because you will have one of these parties, if I start doing something, well, not me, the department, they will take us to court. All this stuff that we do now needs to stand in court. So at the end of the day, we are going to take we have already informed some of these older chaps that I'm concerned about, basically putting them on a line. You've got a due date. If you do not meet a due date, then the next drastic process will start following with you as organization. So that's how we deal with it. I must say it's not easy. With all the programs I've dealt with in this department before, this is one of the most difficult situations when it comes to conflict of board members. Thank you.
Thank you very much, Mr. Jordan. Dr. McDonald.
Thank you, Mr. Jordan. As you can see, that's we've got a long road with some of these organizations. But essentially, the process is for us to try and get them on their feet, and if they can't get on their feet, then we have to look at finding alternative accommodation, and we then move the older persons to different facilities. We'd already seen that with another facility, Spitzkop in Maritzburg, where the board reached a point where the conflict was too much and they decided to close down, and the department then had to find alternative placements for the older people. And it's not pleasant for the older people to be moved from a place that they're used to and they're comfortable, and then they get split up and the social bonds that they formed are lost. So it's really a last resort, but unfortunately, sometimes that is the only option. And the department does have a mandate to protect older persons from abuse and neglect. And if older persons are being subjected to abuse and neglect because of conflict in a board, then we do have to look at moving those older persons. We may not have the right to dissolve a board or to do anything with the property, especially if the property is owned by the NGO, then we don't have any power over that, but we do have the power to relocate the older persons if they are at risk. Chairperson, the last question I think was from yourself, and that was the question on page 36 around the afternoon or after school sites that were mentioned. I think it was mentioned by one of my team that our Outeniqua facility actually works with one of those centres. They use that as a additional partnership. So we do have partnerships with some of the places, but if there are places that are interested in partnering with us, then they often come to the first Thursdays, or they come to the outreach programs and they tell us about what they're doing, and then we put them in touch with our program office and our local regional teams, and then we can start to build partnerships. So yeah, I mean, there's always new places and there's always places that we don't know about. I think also to mention that the youth development work that we do as a department is one part of what the province does, because there's also a lot of work being done in the Department of Cultural Affairs and Sport for youth development, as well as the Department of Economic Development with the e-centers that they've got, which are similar to the youth cafes in some ways. And we do work together with other departments to talk about where there can be synergies between the departments. So if there are any organizations that approach the honourable members that are keen to work with us, we can certainly connect them with us. Thanks to you.
Thank you very much, Dr. McDonald. And then I see Member Stevens, Member Windvogel. In that order, you may, Member.
Yeah, I just want to know, the department was speaking about the two different boards. It's certain older jobs. I just want to know if the Vermont older job, was it part of that that you guys are busy investigating? Thank you very much.
Thank you. Perhaps just before the department respond on your question, Member, you will remember during our visit last week, and we can definitely relate to what was said pertaining to the facility that you just mentioned. We have resolved, we've made certain resolutions as well as recommendations, which was forwarded under the hand of the committee to the department. So the department is already in possession of what the committee found and what we are asking from the department. So in that instance, I would not want the department to divulge on that, because we ask for certain information so that we can scrutinize that and plan our way forward, or give even follow-up recommendations in that regard. But where we sit now, the department knows exactly what we found. They know exactly what we are asking for, as well as we made certain recommendations. So I would like us to give the department the opportunity to come back with that full explanation based on our visit to the garden route last week. Is that in order with you, member? I just think we'll have a holistic picture in terms of what is transpiring.
Yes, Chair.
Much appreciated. Thank you, member. Member Van Vogel.
Thank you so much, Chair. Chair, I think you het me nou stil gemaak. But I think I need to bring the last one in. I want to understand the monitoring system in the department, because I think if we don't have a monitoring, active monitoring system, that's how we get into a situation that we are in now. So if I do, and because during our visits, I pick up that the only people present was from province. There was no local people from the local offices around there. And according to them, they are the people who are dealing with monitoring, and I'm not sure what else. But I really want to understand only that part. Thank you, Chair. Then another follow-up, Chairperson, on the Drug Action Committee. I know that the HOD mentioned that you will send us a type of report and give us all the details, but I want to understand also in that report, if we can't answer now, how many of those are in place and are active, and then how many is still outstanding. Then lastly, Chair, I think, I'm not sure if it was the minister of the HOD, I think it's the HOD, mentioned about the old age, they are only subsidizing people who are getting SASSA. And I really want to understand, because I know we visited, there was an oversight done by an old age home where you only have 2 colored people there. And we are funding them. And I want to understand, if that is the case, I really want to get to how much are we funding them? How much is the amount that we are giving them if we only have 2 coloreds in that old age home in Neisna? I can't remember the old age home, the name of the old age home. So because my understanding is that when social development come into play, it's when there is a need. And who are in need? Those people that are SASSA, people who are getting SASSA. So I really want to understand those dynamics, or how you are really dealing with that. Perhaps it can be one of our recommendation of resolutions to get more information when it comes to that old age home. Then lastly, Chair, I want to understand from the department on sub-program 3.5 when it comes to page 65 and also 72. Perhaps I must just mention, in order for the staff to know exactly where I am, it's about the residential care service available for children in need. And the other one is on the crime prevention and support. So I want to understand, why is it that we struggle to meet our targets there? Can you just explain to us the reason why we miss our targets there? Then lastly, Chair. We know substance abuse is a huge problem, especially the community where I come from. And I want to understand, can you explain to me, why was the targets not achieved? And also, did it happen that how did it happen that the indicator was captured incorrectly? If you can just explain to me that part. And lastly, Chair, the last row on page 82, soup kitchens. We know regarding the rising of cost of living and poverty levels that drive demand for food relief services, and so on and so on. And I pick up that a lot of soup kitchens have closed, especially where I'm deployed. 4 of them were closed. And there's actually no one that I know that are funded by social development. There's 2, but it's like we are, as community, we are supporting that soup kitchens. but nothing from social development. I'm speaking about Swellendam, if I can get clarity on that. Thank you so much, Chair.
You covered then,
Yeah,
Member Van Vogel. Thank you so much. I don't see any hands online. Can I just check them on there? Member Kasim.
Thank you, Chairperson. Mine is also a follow-up with regards to that SASSA grants. I just wanted to check how many residents must that specific old age home have with SASSA grants before they can get funding from the department. And I want to go back to Member Van Vogel's comment as well, because when I raised that question, I remember correctly, because we debated the issue why they were rejecting residents with SASSA grants. And the response from the person who was giving the presentation was, oh no, we do have members with SASSA grants, and that are the two colored ladies downstairs. Keeping in mind that there are only two colored residents on the first floor, and the majority or all the rest are white residents. So I just want to check how many residents must that specific old age home have in order to benefit from the department in terms of funding. Thank you.
Thank you, Member Kasim. Minister.
So as Member Van Vogel would know, I think we fund just over 1,000 NGOs. And we have around about 50 people that ensure that the compliance gets done. That is why the department sits with pretty good reports on the money that we spend. But I want to caution one thing to members, that when somebody gets into financial strife or they get into difficulty, there's no skin color attached to that. SASSA doesn't determine whether somebody is white, colored, or black, and whether they need the support. So the same, we fund space in the old age home. We don't say, listen, you must have X, Y, or Z. As the HOD said, there's a board that manages that. Now, the history of our country and the socio-economic spaces that people have taken up, that might play a role at times. But the funding that we do, as the HOD said, are not for people that can afford it. It's for those that are SASSA beneficiaries. But if you have specific problems or specific concerns that you've got around an old age home, I do think raise that, give it through specific and say, this is our concern, and then we will see whether they comply. But wherever we move through this province and with the economic climate that we're moving into, or that the country is in, and as a member, I'm sure you have picked it up as well. Wherever you move, when you are in financial strife, there's no skin color attached to that. People struggle across the board. And we help people in this province, irrespective of the demographics. And we will try to broaden that safety net as far as possible. On the specifics, on the other questions, I'll ask the HOD to answer that. And then also just, Member Van Vogel, I should probably know that, but you keep referring to the area where I'm coming from. So if you can just enlighten me where the area is, exactly where you're coming from, it will also help narrow down our answers, specifically if you refer to an area. Thank you so much.
Lid Van Vogel, waar is die wortels begrawe of geskiet?
Wortels begrawe in Swellendam. Perhaps the minister must it, I mentioned it.
Okay.
Thanks.
Baie dankie, Minister. Neem kennis. Dr. McDonald.
Thank you very much, Chairperson. Starting with Honourable Member Stevens' question, if Vermont is one of the homes with board conflict, yes, it is definitely. From the question from Honourable Member Van Vogel about the DST monitoring system and the question of should this not be picking up these issues, I think with these homes, we certainly have picked up the issues. We're acutely aware, and in most instances, our teams have been trying to help them for years. I think Vermont has been coming on 5 years. It's been on our radar as a risk, and we've been trying to help, as Mr. Jordan has mentioned. We are, of course, reaching the end of the line with that process, but there are other homes as well where we know there are issues, and we are trying to help them. And the issues range from relatively minor things like they haven't submitted their annual report in time, or something like that, to major things like the board conflicts that we've seen, and the effects that that's having on the functioning of the facility, or things like serious financial problems. So I think the monitoring, the Vermont situation isn't a product of us not monitoring properly. It's a product of an ongoing struggle where we've been trying to get them to come right, and it's not working. So I think the department does have a strong monitoring system, but I wouldn't pretend that it is perfect. We do have limited staff. They have to try and get to every NGO physically over a 3-year cycle. So they do physical visits of funded NGOs once every 3 years, for the across the board as a general principle. But the high risk places that we identify as being a big problem, they'll have to see them a lot more often than that. So Vermont is receiving more attention. Other homes with similar kind of problems. We also have senior managers sometimes having to go there repeatedly during the course of a year to try and negotiate with boards to try and sort their issues out. So, sometimes the homes and other NGOs that we fund, you can visit them once every 3 years and check on them, and they're fine and it's okay. But some of them require more frequent attention, and that's how we deal with it. I think also to say that different types of services require different types of monitoring. So the old age homes, as well as the child and youth care centres and some of the other places, have to be registered too. So there is a process to monitor their compliance with the funding agreement, but then there is also a process where we have to monitor their compliance with their registration conditions. So, and every, I think it's every 5 years, these places have to be re-registered. They've not the old age homes, but the CYCCs. So those kind of things then require further checks on top of our normal monitoring. So there's different ways of monitoring these things, and of course the municipalities also do their health inspections and so on for the purposes of the health clearance certificates and so on. So there's a combined system of oversight. But as I say, with something like the Vermont situation or similar, those things are not things we are unaware of. We are aware of them, and it's not a lack of monitoring. It's the fact that the organisation is in distress, and I think that we try to avoid closure. It's always a last resort, but if we have to do it, then we do it. We've also had some successes with turning around organizations. It's not always doom and gloom, and that's why we don't give up too quickly, because we have seen places really improve as well. In terms of the question about the local drug action committees, I can say that there are currently one, two, sorry, I'll just count it quickly for you. Seven local drug action committees that are active, but they haven't yet submitted their annual reports. There are 5 municipalities that are starting to establish their local drug action committees, and there are 3 that are not yet in any stage of establishing a local drug action committee out of the 30 municipalities in the province. The rest have functioning drug action committees and are submitting their annual reports and of their activities. So that is the breakdown. In terms of the question from Honourable Member Windhoek about local SASSA beneficiaries rather, I think Minister has spoken to that as well, but just to say that the amount of funding that we provide is per bed space, and it's the same across all old age homes. I'll just ask Charles Jordan to speak to that quickly, and also to mention what maybe to respond to the question from Honourable Member Kasim about is there a minimum number of bed spaces that for SASSA recipients that home has to have before we decide to fund it.
Thank you, Dr. McDonald. Mr. Jordan?
Yeah, thank you, Honourable Chair and Member. There's no specific number we require from any old age home. If you have one SASSA person in there, we'll fund that SASSA person. So there's no requirements regarding numbers of how many we should fund or should not fund. I'm not too sure which old age home you've been talking about, but if there's information about that, it could be an old age home that's got 50 people in there, and we're probably subsidizing, say, 20 of them or 10 of them. So it goes about also the criteria. If you're a SASSA recipient, and the old age home applies to us for a subsidy, it's also a means test looking at the person's income. But obviously, if you've got a SASSA income, that's the only income you have. So automatically, we will fund that person. So there is some old age homes. I can give an example. For example, there's Highlands Home in Sea Point, very la-di-da old age home. We've got about 2 or 3 SASSA people, and we fund that 2 or 3 SASSA people. We don't fund all that rich other people in that old age home. So there's no number. If you apply as an old age home and you've got a SASSA recipient there, we will fund that person. Thanks.
Minute Jordan, Dr. McDonald.
Thank you, Chairperson. So I think, yeah, that's addresses the question. I think the department also they'll only work on bed spaces. So if it's 2 or 10 or 50 spaces that are going to be made available to SASSA beneficiaries, we are open to funding it. I think we try to maintain a good spread of those available bed spaces across the province, so that there is access in most parts of the province as far as possible. So that our approach is to try and make sure we have availability as far as possible. We are seeing, of course, as well, that homes that have majority SASSA beneficiaries are really struggling with liquidity at the moment, because the homes that have a significant number of paying clients are able to cross-subsidize more effectively. And where homes are losing paying clients, they are really struggling to sustain themselves. Mr. Jordan would like to add?
Yeah, sorry, I just would like to add, if you look at the annual performance report, that number we've achieved of 4,700 and what else by the older persons, that's SASSA recipients. And as HED said, they are evenly spread. So you do get some older homes where there's 10 SASSA recipients in, but the ones that's struggling is specifically the ones where there's only SASSA recipients in. That you will find in Huis Johannes and Beaufort West. You will find in Vermont. You would find that those kind of organizations, even PJ Strauss and Ceres, they are exclusively only SASSA recipients in those places. Those are usually the ones that's suffering. Yeah, thanks.
Honourable Chair, I think the question around program 3.5 on page 65 and on page 72, the question was about residential care services for children and also crime prevention and support, and why are we struggling to meet our targets there. I'll ask Ms. Goosen to speak to that question.
Dankie, Dr. McDonald. Mevrou Goosen.
Thank you, Chair. In terms of 3.5.1.1, that relates to the NPO child and youth care centres. You will see that we fund our funding is in terms of subsidised bed space. We have lost a bit 2 CYCCs that closed down with a result of 139 bed spaces. We were successful in accommodating that children in our other child and youth care centres by increasing their bed spaces. But you will also see that 3.5.1.2, there's a substantial increase in the number of residents that we accommodated. Some of those children, especially the older ones, were accommodated then in our own centres. So in essence, we lost 39 bed spaces, but in terms of real bed spaces that we couldn't expand on and so on, was 37. And that was as a result of closure. In terms of the crime prevention child and youth care centers, that is our secure care centers for children awaiting trial and sentence youth. There, it's a twofold answer. The one is the children that in our care is awaiting trial for very complicated matters, and that court process takes extremely long. So for that period, that bed space is filled. And the court can therefore not place another child with a court order. In addition to that, there has been a substantial increase in our diversion services outputs. So it's children that we could successfully divert away from our residential care centers, and therefore the court have opted to issue diversion orders. But we can't just take a child in. It must be linked to a court order, and if that bed space is full due to the long process of the Department of Justice and the NPA, that's if in effect blocks that bed for a 2-year period, 3-year period. If I can actually move to the substance one, what happened there is we moved away from a turnover total, where we said, for instance, in this year we accommodated 600 people in our centers, for instance, to a subsidized bed space total. And in that process, there was initially a struggle in adapting to the new method of calculation. So it wasn't that we underperformed, we when the indicator was recorded, we still did it for the one type indicator, the old one, while we counted differently. So in the old one, we would have complied with the NFT data. It was just the staff struggle to adapt to the new indicator for a while. And therefore, it shows as an underperformance while it's just a new indicator. That was incorrectly stated in the beginning.
Thank you, Mrs. Goosen. Dr. McDonald?
Thank you very much, Chair. The question on around page 82 in the soup kitchens, what we call either community nutrition and development centers or also the community kitchens where they provide food. A number of them have closed since COVID, the post-COVID disaster. We received a lot of extra money from Treasury during the COVID disaster and immediately after the COVID disaster to increase the availability of community feeding schemes because of the impact of the COVID disaster on the economy and jobs. And that funding has been reduced since that period. So we are unable to sustain the number of food programs that we used to have. And we still do have a higher budget now for food relief programs than we did before the COVID disaster, but it is a lot less than it was during the disaster and during the year after the disaster. So hence, some of the places that we were able to fund during those years from 2020 to 2022, they started then to be not able to be funded anymore once the funding, the extra once-off funding we got started to be depleted. I think also, you know, if there is a need that the honourable member is flagging in the Swellendam area, we can certainly look and add that to the list of areas where there is a need for attention, because sometimes there's also shifting around of funds where if a community kitchen is not taking up many clients anymore, we can shift some of the funding to other areas. So we'd be happy to be given information on where the need is being flagged, and we can also then indicate if there's an NGO that can help that's already in the area that may need to just look at spreading its area of service, or alternatively looking at existing places that can be supported. But we'd appreciate that information. I think then also the Honourable Member Kasim's question was answered by Mr. Jordan about the minimum number of residents with SASSA grants. So that is all the questions I have, Honourable Chair.
Thank you very much, Dr. McDonald. Honourable members, any other further questions on Part B, pages 35 to 90? Lid Kamfer, u mag voortgaan.
Thank you, Chair. Chair, yeah, my is a bit concerned. I think Chair answer my fellow comrade Stevens about my question that is related to our site visit. But let me proceed with it, Chair. I'm confused, Chair, because most of our visit was the same problem. Most of that was staff, there was resources. And if I look at the report, if I look to page 108, 113, 114, and I see table tabel 3.2.2.
Member, can I please ask, are you in the book?
Yes,
Okay,
Chair.
so we are now up until page 90.
Oh, okay. I'm sorry, Chair. Let me park. I'm page 130.
Okay.
Okay.
We're getting there, member. Thank you very much. Member Van Vogel and then Member Van Minnen.
Thank you, Chair. Mine is very short, Chair, because I just want clarity on the issue when it comes to the issue of the drug action committee. I just want to check if
Member
my
Van
understanding
Vogel,
is.
excuse me, can I just ask that you just adjust your mic a bit, please?
Sorry, Chair. Yeah, mine is on the drug action, local drug action committee. I just want to be on the same page. I just want to know from if I heard correctly, the HOD saying that he will send us more information when it comes to progress being made when it comes to the establishment of the the committee, and also the support given to those committees. What type of support was given to those committees? I just want clarity.
Thank you, Member Van Vogel. I think I heard exactly the same. The HOD is saying that it's quite an extensive list and it can be provided to the committee. And supplementary to that, we can ask exactly what support is provided. Is that in order?
Yes, Chair. I think that the support provided is standard. I mean, we have a dedicated person in the province, in the Department of Social Development, who assists with the establishment of the local drug action committees. And then once those are established, then the DST's local office representatives also sit on those committees as part of the membership, as well as NGOs sometimes and other stakeholders. But the department does provide support to all the municipalities that want to establish the local drug action committees, and that support is provided by the chair of the Western Cape Substance Abuse Forum, who is an official who is appointed in the Department of Social Development for that purpose. So we have a dedicated official to assist with the establishment of local drug action committee, including the administrative work that's required to set it up and all the guidelines and so on for how they should operate.
Thank you very much, Dr. McDonald. Member Van Vogel, follow up?
Chair, on the monitoring, my question on the monitoring side, I don't know if I missed it somehow, but I still don't understand your process when it comes to monitoring those institutions of old age homes. So if I can get clarity, I know you explain you are doing good, they are doing less, staff is not enough, but you guys are doing what you need to do. But I want to understand, where is that component? How is it the flow of that component? Thanks, Chair.
Vogel, if I think it was answered, but I think your question, what you need clarity on, is based on our visits. We saw provincial staff and not necessarily the local staff. Is that what you're asking? Your mic, please. Your mic, member.
And to want to understand the monitoring system, how do you have a unit at the local level, a provincial level, or how does it work?
Thank you, member. Dr. McDonald.
Thank you very much, Chair. Yeah, there's a unit at the head office of social development, the Older Persons Program Office, and they have a team of monitoring and evaluation officials, and those officials go out to all the NGOs through the course of the year. They go out and do site visits, but I'll ask Mr. Jordan to speak to that.
Thank you, HOD. I think, member, I hear what you're saying. So I first want to give just an overall picture before I go into detail. First and foremost, this department does have a standard operating procedure for monitoring and evaluation, and that can be made available to you. It's actually tells exactly the process of how we monitor an NGO. We've got to give notification 2 weeks before the time. We've got to send out an M&E team, and I will get to that just now. So we give them notification. Some cases when we do quality assurance, they've got to do a self-assessment themselves as organization to score themselves. And then we also do with from our side, the scoring and checking up stuff. What do we check up and who's the team? First and foremost, in any monitoring process, there would be a social worker plus an administrative monitoring official. Your administrative monitoring official is not a social worker, and their expertise is to look at specifically governance and financial aspects of an old age home or even any other NGO. We've got basically the same processes. So if I talk about finance and governance, they will check, is there an AGM? Did it take place? Where's the minutes of the AGM? Is there resolutions been made at this meetings? Is there board meetings? Is there financial policies in place? Is there HR policies in place? Is there recruitment processes? Is there buying stuff? Do they have a quote system in place? That's the financial and governance things they look at. They also will look at, do they have a proper payroll system? How do they pay their staff? Is there pay slips? If the staff has been paid, does that person exist? So that's the kind of stuff that they will be checking. And we've got documents, and we can always share it with the committee. Documents where they actually have to fill in all the stuff and provide that information. They're looking also for the evidence while they're doing that. Then the social worker that goes with that team looks again at all the statutory legal things. So for example, we can use an old age home as an example. So your social worker that's part of that team will look at the Older Persons Act and the regulations. Now the regulations has got specific criteria that the old age home must have. It could be from they must have a residence committee in place. It talks about the health and safety issues. It talks about how many staff there should be plus minus. Is the nurse registered? Is the carers being trained? How do they do the dish out of the medication? Because there's a specific process on dishing out medication. So that social worker will check up all that stuff that stands in the act. Then there's another special investigation, that's a health audit. So that's even separate from this normal monitoring process I'm talking about. Your health audit is a whole process that's been developed by the Department of Health, the Institute of University of Cape Town's health facility, the geriatrics unit, nutritionists, and then also, of course, our own department. So specifically when we sometimes have a complaint of an older person that died for medical reasons, we as social workers can't investigate that because we don't have that expertise. So we actually got a professional nurse that we've done through our own departmental procurement process that assists us in doing medical investigations. There's even a list of what needs to be checked in an old age home by a professional to check up all these things. What you have experienced with the team, yes, as the HODF quite correctly said. So each program at head office might be your older persons, your substance abuse unit, your disability unit, and so forth and so forth. Each of those programs, the component consists out of policy developers, that's experts in specific legislation, but they've also got monitoring teams. So the monitoring team, there's a one specifically only for older persons. There's a monitoring team just for the disabled NGOs. There's a monitoring team specifically just for substance abuse, and so we go on. So the people that you would have seen usually at site visits would be your policy developers that's been involved in the assessments of that old age home from head office, because we've also got the contracts. So the people that sign the contracts, the director at head office that sign the contract and manages the money, is also the people that usually comes to those meetings, because they do know what's the contract compliance issues, what's the monitoring issues, what's the progress report issues, what's the financial position of that old age home. So it is a centralized function by head office. Our regions are not involved with monitoring of NGOs, not at all. So that's probably why you won't see a local DSD office being involved with an NGO. Our local offices and our regional offices are rendering various other social work services in our own areas. For example, statutory work on child protection. They also do assist with older persons. They would go to the old age home. For example, when an older person needs to be classified according to their health. In an old age home, you get a category 1, 2, and 3. 3, you fail career. 1, you're healthy. But our social workers from the local office will go and do an assessment to see what health status is this person, because that depends on the subsidy we're also giving. So that's where the local office gets involved. The local office would also help us with the investigations. If there's one, if there's a complaint about food that's bad, they will sometimes help us with that. And then, of course, I think the big thing is when an older home closes down or is being closed down, the local office assists us with the placement and contacting the families of that area. So that's where they get involved. But with monitoring, it's exclusively a head office function because of the contract that's with the head office. The contract is not with the regional office. The money is not with the regional office that's been given to that organization. So, but we can give the standard operating procedures. But yeah, I don't know if I've explained enough. Thanks, Honourable Member.
You covered, Member Van Vogel.
But I'm covered. I'm covered.
Thank you very much, Member. Member Van Minnen.
Thank you. My question here actually pertains to youth at risk. So one on page 65, the issue of the underperformance with subsidized beds due to 2 CYCCs being closed down. So there were less bed spaces available. Is that slack, is there any possibility of that slack being taken up with other facilities opening? That's the first part of the question. And the second part is, I understand part of your role obviously is to monitor, and as you said earlier, the old age facility in Murraysburg had to be closed. When sort of these centres close, one's still going to be sitting with youth, for example, who are in need of care. That's why they were there in the first place. What happens to them? I mean, surely it places them, and it's not the department's fault if the CYCC closes down, but how is it dealt with? Because surely allowing them to return to the situation from which they were removed is going to place them immediately at risk again. So that's one concern. Then if I go to page 72, there's an interesting stat here. So I see that GBV victims assessing support is up, victim support is up, all the stats tend to be on the increase. However, when it comes to children in conflict in the law awaiting trial, placed into secure spaces, which obviously is a necessity, it's down by 40, and it says that a performance is dependent on placement referred by the courts. Now, I mean, I've worked in the courts and I've done a certain amount of work with youthful offenders, so I mean, I understand how the process works. But the fact that that stat seems to be quite out of kilter with the other stats, is there a problem? Are you picking up a problem with the courts, or is it that genuinely they do appear to be less youth offenders? So I'd just like you to unpack that for me, please. Thank you.
Thank you, Member Van Minnen. Dr. McDonald.
Thank you very much, Honourable Chair. The question on the underperformance or the closure due to closure of CYCCs, I think as Ms. Goosen mentioned, we were able to find spaces in other facilities that had some vacant spaces to take up the remaining children that had to be removed from that facility, and that is usually what we have to do. The problem, of course, is when you start to get more closures, eventually you're going to run out of space. Sometimes we're able to negotiate with NGOs to expand their existing space or talk to them about even opening new CYCCs. But eventually, if we have more closures, then that could end up being the case. I don't know if Ms. Goosen, you want to add to that?
Yes, just on the process that would put you at ease, each child have to be assessed, and there has to be an order for the movement of that child to wherever, and that assessment must satisfy the criteria for the change in placement. Fortunately, it's a highly regulated environment, so there may be children that were fostering relations with holiday parents and so forth, where we could successfully transfer them to them in foster care. Then there were a number of children that reached the age for independent living. It sort of coincided with each other because the closures were around December, so they reached the age of 18, and most of those children could be placed in a similar level of care. Then there's a small number of children that, due to evidence of ongoing behavior challenges, were then placed into a higher level of care into the government-owned facilities. No child can actually get lost in the system due to the legislative process prescribed. We do have a small number of child and youth care centers that are registered but are independently functioning in terms of their financial abilities. So we can approach them, as well as our funded ones, to expand their bed spaces. Again, a lot of people approach us for opening of a child and youth care center, but because of the high regulatory environment, they just can't get to the threshold for registration. And unfortunately, as with elder people, that's one of the places where we have to be very strict with compliance, because it's a 24-hour service out of the care of the parent, or we're not always there at night, so we need to know that the child is safe. In terms of the children in conflict with the law, no, there is not a decrease. Our problem is the justice system taking a long time to deal with that child. And for that period of time, that is blocked. We also see the level of crime committed by these youth are extremely high risk, compared to what adults traditionally were committing in the province. And that's as a result of the climate in the Western Cape in terms of gangs, and the fact that the gangs sort of found out that if children are committing these crimes, their sentence would be less. How do we deal with that? We have introduced a early discharge system, which we call, or is a type of parole system. But interestingly, there isn't such a legal system in South Africa for youth, which is actually against human rights. So we have introduced a policy environment regarding that. For the children that do progress in terms of while they are with us, in terms of reaching from external locus of control, where we have to regulate their behavior with our gates and our all the systems, to where we can conditionally discharge them in the community. So at least that there is a turnover. Unfortunately, due to the seriousness of crimes and the law and the complexity of crimes, there is a number of children that have to be accommodated, but we can only take them with a court order. Having said that, there's also a number of children that could be successfully diverted into diversion programs, either in one of our centers, but then it's a set period of time. It's 6 months or a year. It's shorter than a sentence period or waiting trial period, but the child must plead guilty to be qualifying for that program, or it's a community-based sentence. So that's a combination of things that is at play.
Thank you very much, Mrs. Goosen. Minister, if you still have something to say, and HOD, can I just ask colleagues, we are intended to have a short comfort break from 10 up until 10:30. So then we will return for the rest of our program. Minister?
Yeah, thank you, Chairperson. I'm glad Chief Director Goosen at the end spoke about the successes also, about the diversion programs, the initiatives that was started in the Western Cape as well, where some can qualify for early release, and there's also been some great success around that. We're also planning other programs going forward of giving these kids the best possible chance to reintegrate successfully and make a career out of it and add positively to the community. So my invitation to the standing committee is still there to possibly visit some of our centers and see the amazing work that's being done because to break that cycle, it's not easy. But our officials, our staff, they are doing an incredible job working with these children. And I want to commend the team there. And she did touch at the end of it some of the successes we have achieved. So please, if you do find time in your diary, it would be great to also show you firsthand what is being done in that space as well. Thank you, Chair.
Thank you, Minister. Dr. McDonald.
Thanks, Chair. The question from Honourable Van Minen about the GBV figures and other crime-related figures going up, but the children awaiting trial going down. I think Ms. Goosen can also speak to that, but essentially, I think you did mention it, a lot of it is to do with the courts also choosing diversion as an alternative to placing the children in the facilities. But also sometimes we, sometimes it's just a pattern where you get more children awaiting trial because they're taking longer to finalize cases, and sometimes they speed up that, and then the numbers go down a bit. And we do try to get the awaiting trial children through as quickly as possible. It's not desirable to have children sitting in a facility awaiting trial for years. It's a problem, just like it would be for adults as well. But maybe Ms. Goosen, you can just speak to that if I've missed anything.
In terms of the waiting trial, we have a multi-sectoral committee, which is the Child Justice Forum, as well as the regional efficiency of the court systems. And our director behind me, Mashanet Jonkerman, is quite an active voice on those forums to get the child moved as quickly as possible through the justice system. During that phase of ambivalence, the children are unsure about their future, and children express their uncertainty through behaviors, attacking the infrastructure and so on. So it is a high-risk period for us. But we have seen a substantial decrease in children being sentenced. Fortunately, it opened up for us the pressures from the courts and the community for children with behavior challenges, where we could divert that space for children with behavior challenges, which we couldn't in the past, although we still have waiting list.
Thank you very much, Ms. Goosen. Member Winvogel, is that a follow-up or a new question? Because we're coming back, we're taking a comfort. It's the new question. We are taking a short comfort break from 10 up until 10:30. It's now 3 minutes past. We reconvene at 10:30. We are at B now, yes. If there's any further questions on B, we will continue with B. Thank you very much, colleagues. Then we will reconvene at 10:30 promptly. Thank you.
Chair.
Are you covered? Member Van Wyk? Covered. Member Boyson?
Covered on part B, Chair.
Thank you very much. Member Van Minnen? Do you
I'm
still
fine,
have
thanks.
anything? You're good. Thank you. Member Kamfer? Do you still have
Yes,
anything
yes,
on
yes.
part B? That is pages 35 to 90. You're covered. Thank you very much. Colleagues, we are moving along with the meeting. Part C deals with pages 91 to 106. This section will be dealt with in SCOPA, but the committee can ask questions in this part. Are there any members that has got any questions from pages 91 to 106? I see Member Van Wyk and then Member Kamfer.
Thanks, thanks, Chair. I think we've probably covered a fair part of these aspects already, but I think now I've just noted once again that within the risks, all of these critical areas are being mentioned, and I think they've correctly covered the capacity constraints of NGOs, the increased household hunger that we're seeing, the safety and security threats to DSD staff, and
Apologies, member. Which page are you?
Oh, sorry, page 93.
93.
Inadequate human resources, ineffective MPO, contract management. So I think all of those, and a reduction of baseline budgets, I think all of those are the critical issues. And, and as I've mentioned, both the Minister and HOD have mentioned them. So I think, from a committee's point of view, I think it is, we very, we understand all of those difficult circumstances that they have worked in. And I think, to me, what I've seen in this annual report is, the excellent efforts that they've put in to, with their limited budget and obviously the constraints with the work that they've done, and we need to commend them for the work that they are continuing to do. Thanks. Thanks.
Thank you very much, Member Van Wyk. Member Kamfer?
Thank you, Chair. Page 113, point 3.22 as employment and vacancies, Chair. That is a simple question, Chair. And I think Chair said it will deal with in SCOPA. But my question is, I see there's a lot of vacancies, Chair.
Question is on page 113, Member Kamfer.
Yes, 113, yes, Chair.
Thank you.
I see there's a lot of vacancies, Chair, and that was a part of our site visits, Chair. So what I pick up in the report, most of the positions was not filled from the 31 of March 2024. So maybe there's the reasons for that. So what I try to see, or what I try to ask you, there is posts, and I see most of the posts is 113 and 114. So there's no post, there's no there's no fill it. And if it not filled, Chair, my question is, was this post budget that it's no fully? Thank you, Chair.
Thank you very much, Member Kamfer. Member Kasim? Member Kasim, you may proceed.
Thank you, Chairperson. I've got 5 questions. Under fraud and corruption on page 96, it states that there are 3 cases. I just wanted to get an idea of the seriousness of these cases and who are involved. Are those staff members, management, social workers? If you can just give an indication. However, then there's also another page 119, which also speaks to 14 employees being dismissed due to misconduct. And then under page 147, misconduct addressed at disciplinary hearings was 32 cases.
Member
And
Kasim,
they,
my apologies for interrupting you. We are now at part C,
this
91
is
to
under,
106.
it's under part, okay, then it would be the first case. The first question, sorry.
Are you on part D, perhaps?
On page 96.
96. Okay, go ahead, member.
Okay, so page 96, and I think you can address that question for now under fraud and corruption. I'm not sure if they noted down the question in terms of page 96.
Yes, it has been noted, member.
Thanks. I'll keep the others for the next section.
Okay, thank you very much, member
Thanks.
Kasim. And then member Boyson.
Thank you, Chairperson. Chairperson, I'm on page 99. Chairperson, firstly, this is a brilliant audit report from a department that is really doing the best they can under trying circumstances. Chairperson, just over a year ago, on the 23rd of May, on page 99, on the 23rd of May, the department had a meeting with SASSA. And what is currently happening, Chairperson, between SASSA and the post office has the potential to cause a spot on the good work done by this department. So, Chairperson, it would be interesting to know what were the discussions about, because yesterday we were in Vredenburg and we paid a visit to the SASSA offices. And one of the most obvious things, Chairperson, is that some of these facilities are privately owned. And the easiest answer is always that there's nothing more we can do because it's privately owned. And in some instances, and this is the issue I'd like to raise to the department, is that probably the facilities which are privately owned is to get permission or consensus from the landlords in terms of bringing any additions to the facility, for instance, undercover parking, not parking, where the queues are, and I'm sure that some of the tenants would probably do it themselves. If not, then there are some goodwill out there. There might be a sponsor or so that would be willing to do that. That is the first one. And then on page 100, Chairperson, you did warn us, but I just want to add to what has been raised regarding the Vermont old age facility. Chairperson, what I want to bring to the attention of the sitting is that, and I could hear it even when the officials were commenting, the elephant in the room, Chairperson, is the politics surrounding the different boards. For instance, in the instance of Vermont, there's a parallel structure, 2 boards. And what we've observed, Chairperson, is that there were 2 former mayors as well in that meeting, one supporting the old board, one supporting the parallel structure. Now, what I want to bring to our attention, Chairperson, is that we need to deal with the politics of it. The officials are dealing in their reports on what is happening, their intervention. We must find a way on how do we deal with the politics of it, because the outcry is that there are political challenges. So we as politicians need to deal with those political challenges politically. And I'm just thinking out loud as a layman, when you fund an entity and they not doing what they're supposed to do with the funding in the private sector, there's a term curatorship or whatever. Surely we need to find a political way in terms of how do we deal with the finances that we are pumping into that facility whilst we're dealing with anything that might have legal implications. Thank you.
Thank you, Member Boyson. Just on the latter part, I think the minister might be in a position to respond. But again, I do want to ask that once we have gathered all the information and holistically can approach and then further recommend or resolve as the committee based on the specific facility mentioned. Colleagues, are there any further questions on Part C, which will be dealt with in SCOPA? Member Van Vogel? Your mic, please.
Chair, mine, I just want to check with the department when it comes to conditional grants.
Which page are you on, member?
Remember when I left you, perhaps I missed certain part.
Yes, unfortunately, that ship has sailed, member. I've asked members to please reconvene at 10:30. At the time that we started, there was no member indicating any further questions on part B. So we are currently now on part C.
Yeah, Chair, I wanted to ask, what is the reason for the under expenditure when it comes to the conditional grant?
Which page is
But
that,
on
member?
Part C, page 93. We understand that the department's funding constraints have led to the close of several NGOs due to funding challenges. In highlighting the reality of this risk, therefore, I would like to ask what mitigation measures have been implemented to address these issues. And also, when I'm just going to make an example, closing the old age home in the Karoo, Maritzburg. And then my understanding from the HOD was then they transfer those elderly people to different of other old age homes. Is there a system in place where you are saying we are only going to keep them in a region, or wherever, even if it's in someone from Maritzburg, you are sending them to Cape Town, old age home? I just want to understand that, because I know about the situation where the person died and the family would struggle to get the body down. She was transferred to an old age home in Ashton from Maritzburg. So is there not a type of where you are saying, let's say we will do it regionally? Then, Chair, cool on the issue mentioned when it comes to the second sentence on part C in page 93. Could we receive a written report detailing the number of NGOs that the department stopped funding due to these constraints between 2019 and 2023? Thank you, Chair.
Thank you, Member Van Vogel. I do not see any further hands. Minister and HOD, over to you.
Chairperson, so firstly, I am going to respect your ruling that you gave at the beginning, that there was a request from the committee on the oversight visits that you did and then feedback that need to be provided on Vermont. But the one thing that I do want to comment on that Member Boyson has said is that there's the saying, two elephants fight, it's the grass that suffers. And there's a very, very real risk that if the boards or the people that can elect the boards cannot resolve their differences, there's going to, due to their actions, be others that suffer. And that is something that we will even have to have that conversation with other role players involved, and that's got a stake in that, because if that cannot be resolved, they will fall foul on the regulations that we need to look at in order to fund. And then that is not the department's fault if an organization cannot get their own ducks in a row. We need to apply the rules that's in place in order to do the funding. So we need to be very clear with that with one another. The department does a lot to ensure and give the opportunity to correct the systems and get the structures in place. But if that does not happen, there's some very real risks involved. So that's the only thing I want to comment on that. The rest we will report on your written request. Then just on the matter around SASSA. Department of Social Development has the same name in the Western Cape as the Department of Social Development nationally. SASSA does not fall under Western Cape. It's a national entity, or they report to national. but we have gone above and beyond to try and build up a relationship with SASSA so that we can better service the clients in this province. There are some very real concerns that we raise with SASSA on a monthly basis. And SASSA has been also open, and they must maybe answer for themselves on that, what they have put in place. But we are checking up to seeing whether the queue management system is working. Where it's not working, we ask why it's not working, why it's offline, why it's not reflecting on all the television screens. There's also a limited number of people that they can service per day, but can they at least service all those people they've committed to? They also then tell people, listen, beyond this line, we can't really service people, but people still stay in the line for the hope. They've now committed to an online system, but that system must work. I know many colleagues here are now very happily using the new online system to help register people with the IEC, which it did have its teething problems, but now it's working wonderfully well. So we all need to hold them accountable to making sure that we make it easier for people to access the SASSA services. But maybe also, and somebody cornered me when we ended the previous session and say a message to the youth, but maybe there's a message to the youth who's a bit more agile using their electronic devices. Make sure that you assist the elderly that's in your street, in your neighborhood, to maybe use the SASSA online options. And if it's not working, make sure you report it as well. And the other positive is that SASSA has now joined us on the first Thursdays, which even makes it easier. So they did the first one in Grassy Park, and we're looking forward to working with that relationship. But just on the SASSA, we will continue doing an oversight role and take the matters forward. But the specific criticisms are around SASSA and operations there. That does not fall under the DSD Western Cape, although we will take that matters that you raise up with the colleagues there. And for the rest, I'll hand over to the HOD and the team. Thank you.
Baie dankie, Minister. Dr. McDonald.
Thank you very much, Chairperson. The question from Honourable Member Comfort about the vacancies reflected on pages 113 onwards. Those vacancies are funded vacancies. Beyond that, there are quite a few more unfunded vacancies in the department, but those are the ones that are actually funded at the time. So we've got about a 3.2% vacancy rate as at the end of the financial year, and that's of funded vacancies. And a lot of that is to do with staff turnover. We get a lot of people resigning with short notice, and it leaves a post vacant for several months while we then recruit someone to fill that post. And then also one of the patterns we have at the moment is a lot of people in the department apply for more senior posts, and then they get the post and they leave a vacant post behind them. And then we've got to fill that one. So if people get promotions, as it were, then we end up with another vacancy. We fill one vacancy and end up with a new vacancy. It's a very difficult process to predict. But yeah, we generally do see this constant pattern of vacancies and then time taken to fill, and it's taking longer than ever to fill posts at the moment because the Department of Public Service and Administration has put in extra controls because of the fear of the wage bill in South Africa becoming unmanageable, particularly with the increases that recently came. So DPSA has become extremely stringent about filling of posts. And it's increased the time lag for filling posts, unfortunately. So yeah, we do sit with that. The total number of unfunded posts is much greater, but those figures there is the funded ones. See if I don't know if you want to add anything on there. Okay. Then the question from Honourable Member Boyson about SASSA has been addressed. Just to mention also, SASSA is reliant on National Department of Public Works for the procurement and provision of their office spaces, which they've expressed as being difficult because they can't, by the rules don't permit them to negotiate outside of that. that process. So that is one of the challenges that they have flagged. The question about Vermont, I think, was also addressed, so I won't go back to that one. The question from Honourable Member Windvogel, the reason for under expenditure on the conditional grant, I'll ask CFO to give some feedback on that.
Thank you, HED, through your chair. In terms of the underspend there, that was mainly due to the services continuing up until the end of March. And so they could only invoice us in April. So we had to then roll over that funds into the new financial year, and we then paid the rest of the funding. So all the funds were accounted for, but because of the invoice only submitted after the financial year end, we could pay them. So all the service was rendered, everything was paid for. Thank you, Chief.
On the question from Honourable Member Windvogel about the mitigation measures being implemented to reduce the risk of NGOs collapsing, there's a number of things we try to do. We do have the MPO support desk team in the province that helps with capacity building for the boards and management of NGOs. Are the program officers for each type of service, that's the older persons program or the disabilities program, or any of the others, they also do try to assist the NGOs when they pick up that they are not coping with their compliance requirements. In addition, we do keep information on the financial position of NGOs so that we can track if they are getting into financial trouble. We then look at what we can do to help them. But at the same time, we also need to be ready sometimes to step in with our own capacity if we can't find another NGO to take up the slack if an NGO does pull out. We've had a lot of closures of NGOs in the last 5 years, where we've either had to try and negotiate to get another NGO to step in, or we've had to take over the service ourselves, particularly in child protection. BDISA has closed a number of their branches of child protection services, and we've had to step in. Social development has taken over in some of those areas, and in other cases we've been able to find other NGOs like child welfare to take over the area that BDISA was covering. So it depends on the area that's affected what we do, but we always look at trying to get another NGO in first, and then as a last resort we'll take over, because if we take over ourselves, the process to get extra capacity in government, extra posts, is very long and onerous. It's much quicker to get another NGO to take over a service. The other aspect as well is that if we get NGOs that are starting to run into trouble, we also see if we can't reduce their footprint a little bit so that they are under less pressure, and we try to then see if we can get some of their clients to go to different NGOs, and we give them a service delivery improvement plan to assist them and guide them in terms of turning things around for themselves. So there's a number of measures we have to put in place, and it depends on the type of service, what sort of things we have to do. I think then that also goes to the third question from Honourable Member Windvogel about what is our approach to moving older persons if an old age home closes. The people in old age home, we have to assess each individual one of them and see, what's the best option for them. If some of them can return to their families, then that is one of the possibilities. Otherwise, we look at those who still have family in an area and try and get them close to that family if we can. There are some older persons also who don't have any family, so if they're moved somewhere else, then it doesn't affect their family ties because they don't have anyone. But it's always a consideration to try and keep them together with people they know as far as possible, so they've got some kind of social network. We do know about the case in Ashton, and thank you, Honourable Member, for flagging that. It was brought to our attention, and we did assist with the return of the body to the Murraysburg area for burial. But that is unfortunately sometimes the consequence of having these places closed down. But I mean, the Spitskop closure was not initiated by the department. That was initiated by the organization themselves. But you know, in other instances, we may have to do similar things if the places can't operate any longer. So we do try as a first option to keep people in the same area, and then if we can't, we have to look at alternatives. The question from Honourable Member Windvogel about getting a list of the NGOs that social development has stopped funding, we can provide that. Most of the NGOs that we have stopped funding has been either because they didn't apply again. There's quite a lot of organizations that didn't apply when we did our fresh round of funding proposals, call for funding proposals. So some didn't apply, and then there were others that informed us they couldn't operate any longer and they stopped their operations. And then there were others that were non-compliant and we had to stop their funding. So we do have that database of all NGOs that we are no longer funding. We can provide that to the committee. Thank you very much, Chair.
Thank you very much, Dr. McDonald. Colleagues, we are on Part C, pages 91.
Excuse me, Chair, I missed the one question response on from Honourable Member Kasim. The 3 provincial forensic service cases that were in they do not involve social development staff. Those 3 cases are related to reports of alleged misuse of funding at NGOs that the department funded. So all 3 of those cases are NPO related, alleging misuse of funds and fraud at 3 NGOs. And those matters were all reported during the year under review. So it's the 3 cases that are referred to. Thank you, Chair.
Thank you very much, Dr. McDonald. Colleagues, we are currently on Part C that will be dealt with in SCOPA as well, pages 91 to 106. Are there any further questions on Part C? Please don't sneak in Part B because I will notice and I will stop you. We can conclude on Part C. Thank you very much, honourable members. Then move to Part D, Human Resource Management, pages 107 to 167. Human Resource Management. Member Kasim, I see you. You may proceed.
Thank you, Chairperson. On page 119, it speaks to 14 employees being dismissed due to misconduct. And then also under page 147, misconduct addressed at disciplinary hearings was 32 cases. There are 14 cases of assault and threats to assault. I just wanted to get an idea here as well. In these cases, is it staff members or managers or social workers? If you can just give an indication. Then on the same page, it says 57 cases of grievances resolved and 44 are not resolved. However, at the end, under notes, it says all resolved and unresolved has been finalized. I just needed clarity on that as well. And then on page 151, it speaks to 106 injuries which occurred while on duty, in which 5 is temporary disablement and 106 permanent disablement. Can you please elaborate more on this and the seriousness of these injuries? And then lastly, my last question for now, on page 156 under irregular expenditure, it speaks to irregular appointments of staff. And just below that, it then states irregular expenditure condoned for the two irregular appointments of staff and 3 cases of non-compliance. If you can also just give clarity on this, please. Thank you.
Thank you very much, Member Kasim. Member Van Minnen and then Member Windvogel.
Thank you very much. On page 120, reasons why staff resigned. 68 had no reason provided. Do you have any, supposed to be anecdotal, any idea what the reasons were for that? And I also just want to find out if there was possibly a link to people thinking they needed to cash in their pensions prior to the two-pot system coming in. Thanks.
Thank you, Member van Manen. Member Van Vogel.
Chairperson. Chair, mine is on page 108. I just want to check with the department, aside from the employee health and wellness program, what other services do you provide to support staff members who are targeted and attacked while on duty? Then, Chair, on page 114, table 3.23, employment and vacancies. I think one of the members starts on that. I want to check why is there such a high a number of unfilled critical positions? And secondly, what is the number of unemployed social work graduates, and what is the justification for not filling these social workers positions when there are so many graduates in need of employment? And then on page 156, it is mentioned that the department ensure irregular expenditure due to the irregular appointment of staff. Could you provide more details on how this occurred and how many appointments were irregular and for which position? Then lastly, Chair, on page 117, I want to understand what are the reasons for the high turnover and what challenges does this present for the department? And what are the skills and experience that the department lost as a result of these staff exit? Thank you, Chair.
Thank you, Member Van Vogel. That deals with the questions on Part D, it seems. You may proceed with the answers. Thank you.
Thank you very much, Chairperson. The question from Honourable Member Kasim about the dismissals due to misconduct and the nature of the assault cases. Those cases would be cases of child and youth care workers who've assaulted children in most instances. Unfortunately, we have a number of those incidents every year where we have in the facilities child and youth care workers who they get provoked by the children and sometimes then hit the children and then that results in a disciplinary process and a dismissal. So that is the nature of those assault cases. The facilities are a very difficult space, the secure care facilities. There is very limited empowerment for child and youth care workers to deal with aggressive behavior from the children, and they have to be trained very carefully in control and restraint procedures. But unfortunately, some of the staff seem to lose their temper and then they commit acts of assault. So that is unfortunately the pattern, and we've seen it for a number of years in spite of trying to train the staff to stick to acceptable control and restraint measures. And then there are other kinds of incidents where staff are just verbally provoked as well, and they lose their temper and assault the child. So that accounts for the bulk of the dismissals that occur in the department. The unresolved grievances question, I think, speaks to the grievances where the staff member can't be assisted with what they want, and then the matter usually then ends up going to arbitration in the bargaining chamber for the matter to be dealt with as a dispute. So if this grievances can't be resolved, then it usually escalates to a dispute process that is then handled according to the dispute procedures that are set out for the public service. Grievances vary widely. A lot of the grievances we receive at the moment are due to people applying for temporary incapacity leave, and they don't always provide all of the necessary documentation for the temporary incapacity leave. And that actually inflates our grievance figures a lot, because the way that the temporary incapacity leave appoint or application process has been changed by the National Health Risk Manager is that now staff have to submit their documents and then it gets turned down if the documents are not complete. And then the person has to lodge a grievance if they want to change that decision. Previously, the missing documents could be requested and then they could be sent through and the issue could be resolved. But for some reason, it's been changed so that it has to go to a grievance now. So that is inflating our grievance figures when it could just be a simple case of requesting outstanding documentation, but it's not within our control, unfortunately. And then there are certain other grievances that arise from a range of other issues, but the bulk of them are those grievances around temporary incapacity leave. The 106 injuries on duty, there are injuries occurring in the facilities when there are violent incidents that occur, and so those account for some of them, and there's also car accidents. But I'll ask Ms. Van Wyk whether she's got a little bit more detail perhaps on that, or whether she can provide the detail and nature of those occupational injuries on duty.
We don't have the expenditure at the moment, but we will provide a detailed list of the expenditure. Yeah.
Thank you very much, Ms. Van Wyk. The irregular expenditure on 156, and that was a question posed by both Honourable Member Kasim as well as Honourable Member Van Voorkel. The nature of that irregular expenditure, there were 2 appointments that were made at senior management level. That was during the year, prior years, so that it wasn't during the year under review, it was actually before that. And I know we have previously also given the details to this committee. The 2 senior management appointments where the appointment process was deemed to be irregular due to the composition of the interview panel. It was chief director posts, which are level 14 posts, and the interview panel was chaired by the MEC at the time, and the appointments were then made. The Public Service Commission subsequently flagged that there was a gap in the legislation that empowers MECs to sit on or chair interview panels. So the legislation provides for MECs to chair interview panels for level 16 and level 15, but not level 14. And so there was an oversight in terms of the process, because in departments where the HOD is a level 16, the direct reporting officials to the HOD are level 15. So in most departments where there's a level 16 head of department, the MEC also sits and chairs the panel for the people who report to the HOD, because they are level 15. But in social development, the HOD is level 15, and the people who report to the HOD are level 14. So the MEC sat on the panel, and the Corporate Service Centre didn't pick up that it was a problem, because they saw it as the same process as when MECs sit on panels for deputy director generals or level 15 appointments in other departments. But it was subsequently realized that the Act doesn't mention level 14, it only mentions level 15 and level 16. So therefore, the process of the appointments was deemed to be irregular because there's no empowering provision for the MEC to be on the panel for a level 14 appointment. I think it's the first time that this kind of issue has come up. The Public Service Commission indicated that it was a precedent-setting matter, and the Public Service Commission also found that there was no ill intent, but rather it was an administrative oversight. The subsequent process that the department had to follow was then to proceed to the Labour Court to request that the court either set aside the appointments due to the irregularity or to confirm the appointments and notwithstanding the irregularity. The Labour Court opted to order that the appointments remain in place since since it would be just and equitable for the appointments to remain, and because the process itself was otherwise followed, with the exception of this irregularity. As a result of that, the expenditure that was involved in paying the salaries of those posts was then regarded as irregular up until the court order, which then essentially condoned the appointments, and then the irregular expenditure then falls away because the matter has now been regularized. So the irregularity is then removed from the accounting. So that is how the process is followed. The Public Service Commission did also submit a report on this matter to the provincial legislature at the time. The question from Honourable Member van Minnen, the reason for staff resigning, with 68 not providing reasons. We do find that a lot of the staff have left because of financial reasons and they want to take their retirement funds early. Some of it may have been linked to concerns about the two-pot system, but it also is a result of a lot of people finding themselves in financial difficulty post-COVID with the rapid increase in interest rates and other things that people then opted to take their retirement funds. So unfortunately, we did lose a lot of people, and we have lost a lot of people this year too, for the same reason. But not everyone also not everyone decides they want to involve themselves in an exit interview, so we don't always get their reasons. So there's been some people who have left at very short notice, so there hasn't been an opportunity to get a proper exit interview with them. On the question from Honourable Member Windvogel around what support is provided to staff who've been attacked on duty besides the employee health and wellness program. I think the employee health and wellness program is more of a proactive program to support employees in the workplace to be aware of their health and their needs to exercise self-care. But alongside that, there is a service provider that is appointed, which actually provides health services to employees. So when employees are attacked on duty or subject to any kind of trauma, then the department engages the service provider for the province to arrange for trauma counselling to be provided by the service provider. So the service provider then arranges for professional psychologists to provide the necessary trauma support to staff who have experienced trauma. So that is provided through our contracted service provider that's available for all departments in the province. It's procured through the Department of the Premier. In addition to that, of course, our own social workers, if it's social workers that are affected, their supervisors can also provide them with support as well. The question from Honourable Member Windvogel about the number of unfilled critical posts. The critical posts span not only social work, but also child and youth care work. We have a lot of vacancies in the child and youth care worker posts. We do struggle to find suitable child and youth care workers. So we have to advertise in large numbers at a time to try and attract enough people. And we do find that, especially in some of our facilities like Outeniqua and Clan William, which are in relatively rural areas, that it's not easy to find staff who meet the requirements to be appointed as child and youth care workers. So it's not only social workers. We do sit with some social work vacancies, but the most challenging vacancies to fill actually the child and youth care workers. The social work graduates often are successful in applying for vacancies. We find a lot of the graduates that we appoint in the department to work back their 4-year obligations, then apply during that 4-year period for a permanent position, and they are successful. So we've had a lot of social work graduates who have taken up posts. But as I mentioned, also the time lag between staff submitting their resignation and the time it takes to fill the posts is usually the reason why we sit with some vacancies at any given time, because there's always a gap between when people are resigning and when people are finally appointed after a process. And we don't always find people, as I've indicated. The the question, I think, for also from Honourable Member Van Vogel about the loss of skills. Yes, we do have a challenge with losing some of our skilled staff members. But it's, I think our primary concern is among the social service professionals and especially the child and youth care workers, because of the scarcity of that. The social work, the senior social work posts, like the social work policy developer posts, as well as the social work policy managers and the social work supervisors and managers in the regions are also a concern for us because those posts are not easy to fill. There's a very high threshold for filling of those posts in terms of the number of years of service that a social worker has to have within the occupational specific dispensation that's prescribed. It's not that easy to find people with those many years of service. And we've actually asked the DPSA to relook at the occupational specific dispensation because it's actually really onerous and in terms of how many years of service you actually have to have before you can meet the minimum requirement to apply to be a supervisor or a manager. So yeah, that is a challenge when we lose those kind of staff. So yeah, I think it's less the entry level social workers that are difficult to fill posts and more the experienced social workers that we are struggling to fill posts with. So I think that is the questions I have.
Thank you very much, Dr. McDonald. Colleagues, Part D, can we conclude? Any further questions? Any further questions? Member Van Vogel?
Yeah, Chair, I want to check on page 114. Sorry. I'm missing now.
Page 114.
Yeah, sorry. No, not 124.
124.
Sorry. The employment equity, what are the department's employment equity targets, and how serious is the commitment to achieve them? It will actually be wonderful if we had something in writing in terms of your organogram and so on. And then secondly, Chair, what is the number of persons with disabilities that are employed in the department? And then also on page 29, Chairperson, when it comes to
is that 129?
Yeah, Chair, 129. Sure. When it comes to DC issues, what positions did these individuals hold? And what details can you provide regarding the misconduct they face? There are no names, but at least give us an understanding of the type of offences. I also think there is on 147 bottom table, they mentioned grievance lots. Okay, could you also give us some details about these grievances? No names, but the understanding of what grievances it entails. Then lastly, Chair, I also want to understand on 147 table on top, could the department or the HUD or the minister explain to us the connection between the outcome of the disciplinary action and the specific types of misconduct involved? Thank you, Chair. I think I will park there.
Thank you very much, Member Van Vogel. Minister?
Chairperson, we can just double check, or maybe Member Van Vogel can expand, because I think at the latter part, the HOD in his previous response just answered all of those questions about the grievances and all of that. But maybe if you can elaborate on something that we might have missed, happy to elaborate that. But as far as I understood the response from the HOD, that was covered. We are fully committed to reaching employment equity targets. But as you can see in front of you as well, we are one of the departments that have the highest percentage of female employees. And also, if you look down the columns there, we are pretty proud of where we are as a department. But of course, there's always depends on from where the person is viewing. There's space for improvement. But what I can say is that I am incredibly proud that there's fit for purpose appointments that's being done, and that in spite of the incredible workload and pressure and trauma that our staff face, they do an incredible job. So, Chairperson, if we miss something on the latter part, please, if you can just point that out. But my thoughts were that the HOD did cover the latter part of Honourable Van Vogel's questions. Thanks.
Member Van Vogel, any additions to?
Yeah, Chair, perhaps I missed that part, but my understanding when he explained to us was on my question when it comes to irregular expenditure due to irregular appointments of staff. That was my understanding. Perhaps I thought that's what he's trying to explain to me. Then it means he didn't explain that part to me. I'm speaking about on page 156. I smuggled that in with the question on 114, table 3.23. So perhaps then I need clarity on that, but I'm not satisfied with the answers according to me, my questions was not answered.
Thank you, Member Van Vogel. Minister?
Chairperson, Honourable, through you, Chairperson, Honourable Van Vogel, that was the process that the HOD explained about the appointment of the senior staff members and the composition of the panel, and then the salaries that were paid until the court order was made. So is it that part, or is there something else that you are not clear about? Because that was the one that the HOD referred to, the irregular expenditure linked to that. If we missed that, please point out.
So we need to be on one page. I think that's what we are trying to do. Are you saying, through you, Chairperson, the Minister is saying that the question that I asked on page 156, when it comes to irregular expenditure due to irregular appointment of staff, are you saying that was in that question, the HOD answered that question? My question then, my second question or third question was, what position did the individual hold? Or are you referring to that questions? Which one are you referring to that?
Minister?
Yes, so we are on the same page. Maybe it's because both of us are using our second language. But yes, that is correct. And that's the positions of chief directors that was referred to, that the HOD also answered. And that was also the one that finally went to the court and also served in the parliament. Honourable Van Vogel.
Thank you, Chair. But I think the other questions you will still answer, the misconduct and all those.
Thank you, Member Van Vogel. Dr. McDonald.
Thank you very much, Chairperson. So, Honourable Van Vogel's question about employment equity, I think Minister has spoken to it, but our targets actually lean towards increasing the number of males particularly in the social service professions, which it's very difficult to do. The department had many years ago, they actually had a bursary program specifically trying to get more male social workers into studies, and that didn't really work either. So it does seem we will remain skewed towards female staff in that respect. I think the one area where we struggle a bit with employment equity is disabilities. We're supposed to be targeting 2% disabilities in the department, and we are not there. I think the challenge we're sitting with is we don't get a lot of applications from people with disabilities that meet the requirements for the appointments. And also there are people in the department who have disabilities who don't want to declare the disabilities as such for the purpose of employment equity statistics, and that is their right. So the number is an underrepresentation of the reality, but it's not something we can force them to do. But in terms of employment equity, we are not off a long way off where we need to be. But we do have an overrepresentation of women. But as I say, the nature of the social development or social work profession is actually generally that is the majority of the social workers coming through the system are female. So it's not a huge cause for concern for us because we don't believe anyone is being prejudiced by the fact that there are more females than males. It's not like we have male social workers who are trying to get work who are being discriminated against. It's more of a matter of supply. The question about the on page 129, the issue of disciplinary matters. I just want to get there quickly. So if we look at the disciplinary action, the majority of cases, as I've mentioned, have been around assault in the facilities. But we also have a number of staff who've made themselves guilty of misconduct by absconding. They just disappear, and then they actually by default become dismissed by virtue of the Public Service Act. So if an employee disappears without being contactable or doesn't report to work for more than 30 days, they automatically become dismissed in terms of the Public Service Act. So those are the main, that's the main other reason that dismissals are happening besides the assault matters that I'd mentioned earlier on, where the bulk of our dismissals are around assault cases of child and youth care workers assaulting children. But there are one or two other cases where we've had other issues, but those make up almost all of them. There are also some employees who've been found guilty of other forms of misconduct, like unapproved absenteeism, other things like that. The Honourable Member Windvogel's question about grievances, I think I did speak briefly about that before. The bulk of grievances are around the temporary incapacity leave processes, where the official puts in a temporary incapacity leave application. So they've used up their leave. They then put in a temporary incapacity leave application that has to go to the health risk manager in Pretoria. That application is then considered based on the documentation provided by the official. And if the official hasn't provided enough documentation to satisfy the health risk manager that the temporary incapacity leave should be approved, then it gets rejected. And then the mechanism is that the employee would then need to lodge a grievance so that they can submit further medical evidence to have that incapacity leave overturned, the decision to decline it overturned. So we do have a lot of grievances that come through because of that. But then there are also grievances relating to issues such as staff not receiving pay progression that they believe they should receive, or issues of staff being unhappy with one or other action of the employer. For example, if they're not happy that they didn't get a transfer, or if they're not happy with their manager and they want something done about their manager, then they might put in a grievance against the manager. So those are also some of the grievances as well. But the large number is made up of these non-approvals of temporary incapacity leave. So I think, yeah, those are the questions I have, Honourable Chair.
Thank you very much, Dr. McDonald. Colleagues, I do not see any further hands. None online, Lemonde. Part D, Member Windvogel, you have another question?
It's more an follow-up or just need clarity. Let me continue with this foreign language. You mentioned the type of grievances. So there's no sexual harassment grievances in your department. Thank you, Chair.
Thank you, Member Windvogel. Dr. McDonald.
Thank you, Chair. Sexual harassment complaints won't normally come as grievances. There's a process for reporting sexual harassment cases in our department as per the harassment policy that's been adopted by the province. So if there's a matter of harassment, sexual harassment, then the complainant would then approach the sexual harassment contact officer for their unit, and they would be assisted in laying a complaint, and then that would then become a disciplinary investigation that is conducted by the Department of the Premier's Employee Relations Unit. So they would then investigate the complaint of sexual harassment and determine an outcome. I just want to check with Ms. Van Wyk whether there's been any sexual harassment matters during the year under review. I don't recall any.
No,
Thank you, Dr. McDonald. Ms. Van Wyk?
No.
No.
Okay, there's no cases during the year under review, no.
Thank you very much, honourable members. I believe that now deals with Part D of the annual report. Parts E and F deals with financial information dealt with by Scopa, pages 168 to 249. Thus, we can trust from the committee side the annual report for social development for the financial year 2023-2024 has thus been formally tabled. Just for the record, colleagues, this is also a full-scale public hearing. I do not, or kindly let me rephrase, please do indicate if there are any members of the public present at this point in time that would like to pose a question. None? Thank you very much. So there's no questions from members of the public, none present. Minister and HOD, we have come to the end of our meeting, colleagues. We will still have some deliberations as the committee afterwards, but for the formal part of the meeting and the interrogation of the annual report, we can conclude. Let me just also from my side as the chairperson, just say thank you very much for your indulgence, Minister, HOD and senior management team for the committee this morning. And I know this is ongoing, and I think us as a committee can really experience in our approach with yourself and the department that there's always answers forthcoming. I know we are also in the red, Minister. We owe you a date for the SWIMS app demonstration, and then now also we take note of the CYCC's visit as well. If I can just ask perhaps on behalf of the committee, us being now engaged in this process as well as the legislation on our table, the program is a bit hectic, but that is something that the committee wants to embark on. So if you can kindly just provide a procedural officer with some time just to revert back with a suitable date, which colleagues can fully engage on the SWIMS app and the CYCCs, we will certainly do so. Minister, any parting comments from your side?
So I firstly want to start by thanking the officials in the department that's really doing an incredible job. I said that earlier, but it's a very difficult department to work in, and they're doing it with dignity and at all times making sure that we look after the well-being of our clients. So from the HOD, the chief directors, and every staff member down, thank you so much for the work that you are doing. And then to the committee members themselves, I'm really glad that I've got each and every one of you keeping an eye over the work that we are doing. And this is a good start, respectful start to the term, and I'm looking forward to building on that. And Chairperson, I do know that you are really busy, so you're not in the red. It's a standing invitation. And as members would have seen, we launched a mobile office yesterday servicing some of the most rural parts of the province. And to the committee, we will also maybe see when the next ones are being rolled out and you have time in your diary. It's also good that we know the services that's available so that we can go out and advocate that as a public representative serving this province. But thank you so much.
Much appreciated, Minister. It seems like we will put a day aside to embark HOD.
Thank you very much, Honourable Chairperson, and thank you to you and the honourable members for the questions and for also providing your insights and perspectives, which it's always good to have more ideas and more eyes on what we're doing. It gives us additional perspective. I think also just to say, I forgot to mention, but we do have the employment equity plan for the department and the employment equity reports that we can certainly make available to the committee should that be required. All departments by law are required to have employment equity plans as well as report. So we do have that if required. I just forgot to mention that in my reply. But yeah, otherwise I'd like to say thank you to the committee and to the Minister for his support and to the team, DSD, for everything that they've done to get us through that very hard year. And we hope that we'll get through this year too.
Thank you so much. We do appreciate the incredible work that all of you are doing. Thank you so much. Have a most blessed day ahead. Thank you. You are excused. There will be some members, committee members. Can I please ask that you take your seats? We are not yet done. Member Van Vogel and Member Kamfer, we are still in session. We're just excusing the department. There are some refreshments at the back if you so wish to indulge. That's so much hard. Mm-hmm.
I think we must give them time to engage because some officials are going to disappear.
5-minute break.
Yeah.
You still have some
25
time.
minutes, yeah.
Colleagues, then committee members, if you perhaps quickly want to stretch your legs for 5 minutes. We, as a committee, can make recommendations to be incorporated into the committee report. Are there any such members that wish to do so? Your mic, please, member. Van Vogel, your mic.
Thank you, Chair. I think mine, I want to pick
You
it up.
recorded those, Namonde?
Yes.
Yeah.
Chair, there are a few that I've recorded, but I'm not sure if the member still wants the info.
You can read them out, then we
Okay.
can.
It's the list of municipalities with active local drug action committees. Progress made on implementing the local drug action committees and the support given to the committees. Exact number of social worker graduates that are unemployed in the province. Then the department requested Member Van Vogel to share the information with the department regarding the need for soup kitchen or closure of soup kitchens. She mentioned that
The information of which is referred to.
yes, so she needs to share the info with the department. Standard operating procedures for monitoring and evaluation of old age homes in the province. The committee resolved to visit the CYCCs to see some of the successes. List of NGOs that are no longer funded by the Department of Social Development in the current financial year. Detailed information on regular expenditure under assessment, determination, and investigation for the 2023-2024 financial year, as stated in page 156. That's
Thank you very much, Ms. Jamke. Colleagues, anything else? You happy with what is captured? Member Boyce?
I'm covered, Chair.
Thank you very much. We then unanimously agree. Member
Maybe we-
Stevens?
Yes, Chair. Only the one thing that I also picked up on our visits, especially the hospital with the gender-based violence, that there were not enough trained prosecutors and police to assist. That's why there was so much unsolved cases in that. You can remember in that one, I think it was in George, where there was so many unsolved cases. If they can maybe also look into that.
Was that with the engagement with the Tutuzela Center?
No, that was at the hospital we were at, where there was that small space.
It is the Tutuzela Center.
Tutuzela Center, yes, that one.
Okay, so you want us to?
To also make that a priority, because to me, the stakeholders are not taking responsibility to their commitment. So if there's a limited budget on that, if they can maybe look at the budget to maybe see that there's a proper help to get, how will I say it, to look into that, to help those people or to train more people or to get enough prosecutors, because to me it seems like the prosecutors were the problem, that the courts were the problem. Like there's not enough prosecutors to look at the cases of the GBV cases that was reported in that areas.
Just need to frame that. We need to note that perhaps, member Namonde, I'm not sure when we will be considering our joint oversight report as well, and see how we can formalize that recommendation.
Yes, because I think there's a funding problem in that area when it comes to the courts.
Yes, it will form part of the visit report, member. Member Kamfer? Your mic, please, Member Kamfer.
Thanks, Member Chairperson. What I will mention is you are correct. The oversight report, there's certain things in the report what I think that is social development and health. What maybe I will see finance wise, and who can I assist, who can I see that to compile it. For example, Member Van Vogel make an example that firefighters of the ambulance must make, in the whole province, make a presentation to us. So all the NGOs must come and make maybe a presentation to us and see how can they cooperate all these things to make the service better in the whole province. For example, the other example, so the home-based care of the social development, the home-based cares can assist with the clinical and the older age. So maybe that. Thank you, Chair.
Thank you very much, Member Kamfer. And I think a lot of what we're saying are going to transpire from our visit report, because that is actually where we pick that up. I love it when you say Member Chair and not Comrade Chair. Colleagues, thank you very much. I believe Nomonde has captured what is necessary. The date for us to consider our committee report will be communicated to us at a later stage. And if there's nothing else, members, that deals with our business today, thank you so much for your engagement. It is much appreciated. There are some refreshments at the back. And tomorrow morning, those colleagues that will be leaving from WCPP or 4 Dorp Street, transport will be leaving promptly at 6:30. Thank you very much, colleagues, and have a most wonderful day. See you in Scopa at 2. Meeting is adjourned.